Okay, we are going to continue. Now, let's look about some of the pros and cons of universal health coverage. In as much as universal health coverage is so good and fascinating to the ear, there are so many pros and cons of it. The pros, like the positive points of universal health coverage, it lowers healthcare costs for an economy. It forces hospitals and doctors to provide same standard of care at a lower cost, and it eliminates administrative costs by eliminating the need to deal with private insurance. Now, if you look at the cons, the healthy people or the wealthy people, they are forced to pay for the others' medical care, because most of the policies that have been used by this universal health coverage policy, they are using the issue of national insurance, insuring the citizens via a national insurance scheme. If you're in some countries like Cameroon, Nigeria, Rwanda, Kenya, Ghana, these policies have already been implemented, where they are trying to make people understand the need for national insurance, the need to insure yourself. Now, another con is that without financial incentive, people may not be as careful with their health. In Africa, it's a common disease, not just in Africa. People want to see where their money is going to. How is this money going to benefit you? And all the like. Most universal health systems report long wait time for elective procedures. Now, in as much as we're talking about universal health coverage, this is a highly political topic. Why? Because the core and the key to achieving universal health coverage lies in policy making. If the right policies are made and implemented with the good of the community in mind, then universal health coverage is going to be very much achievable in Africa. But because of greed, oftentimes, this is a very difficult situation, very difficult to handle. If you look at the goal target of SDG number 3, it says to ensure healthy lives and promote well-being for all at all ages. Now, achieving universal health coverage, it involves you, it involves me, it involves everybody, because we all have a role to play. I'm from Cameroon, and I have seen in certain situations where there are health insurance schemes, but we are not ready to enroll ourselves in the health insurance schemes. We do not even trust the government to insure our own lives. We do not even trust the government to say, okay, like this insurance scheme is going to benefit us. The truth is, most insurance schemes are existing, but the citizens are either not aware or they don't trust the government enough to enroll in those insurance schemes. And that is usually a big problem. Oftentimes, the government also selects some certain companies to force their owners to enroll their employees in insurance schemes. Now, the question is, those in the rural communities, those in those underprivileged communities, how do we get to insure them? How do we make sure that they also achieve quality health care? If you're a community health worker like me, you will discover that in most rural communities, there are very few community health workers. And according to me, community health workers are the key in achieving universal health coverage. If you have community workers who are willing to go down to those communities and act as a linkage between the hospital and the people, then universal health coverage will be possible. But now, why are community health workers not going to the communities? Very little pay. Some of them are even neglected because they have to travel for long distances just to be able to get to those communities. You get to the communities, there is no light, there is no water, and there is nothing. How then can you achieve universal health coverage if we keep neglecting the rural communities? Those are the epicenters where we need to be focused on. Because if the rural communities are not taken care of, how then do we make sure that everybody has equal access to health? Community health workers are the key, and that's where volunteers also come in, because community health workers are practically volunteers to health. If you're owning an NGO presently here, or you're so much interested in health, ask yourself this question: how many people in those rural communities have access to quality healthcare like you? You wake up in the morning, maybe you're able to drink potable water, you're able to eat good food, you're able to have access to medicines. How many of those rural people are able to afford those medicines? How many of them? Like I mentioned, Rwanda has been doing a good job, but we cannot use the one-size-fits-all approach, because, like I said earlier, Rwanda is a relatively smaller community as compared to other larger nations like Nigeria, like Cameroon. So we cannot compare our system with theirs. We can't compare. So in essence, what are we saying? Universal health coverage in Africa is possible. Health for all is possible. One Health is possible, but we need to work together to be able to achieve universal health coverage. So many of us will be hearing universal health coverage for the first time, but this is a topic that is eating deep into the society, and it's not just peculiar in Africa, because there are several countries like the UK that have covered several milestones in order to achieve universal health coverage. Different countries are putting it to be able to achieve universal health coverage. So I leave you with one question, those of us attending this webinar today. As an African, what are you doing to ensure universal health coverage is achieved? What are you doing to make sure that those that are found in those rural communities are benefiting from services like you? You may tell yourself, oh, I'm not a governor, or I'm not a policy maker, I'm not an NGO owner. Are you a volunteer? Will you be ready to volunteer your services to those communities? Some of us are medical personnel, but we are not ready to go down to the rural communities because there is little or no pay. Some of us are government staff. You know the situation down in those rural areas. What are you doing to make it known to the government that those people in those communities are suffering? Universal health coverage is achievable, I believe, in Africa, and let's work together towards a good health and well-being for all. As the saying goes, universal health coverage leaves no one behind. We leave nobody behind. UHC 2030 is possible. This is 2020. We have 10 years to go. A lot can change in 10 years if you, if me, and if all of us can work together to achieve UHC. So thank you very much, Manu. And I think I'll hand over the platform back to you, irrespective of all the network issues. Thank you so much for the opportunity.
Okay. Thank you so much, Ada, for this wonderful presentation on policies in Africa about universal health coverage. Wow, I really gained a lot, and I'm sure most of us here gained a lot as well. I think we have questions pertaining to the presentation, and the chat section is there. You can always feel free to include your questions there. And then at the end of this panel discussion, at the end of this first session, we will take in all your questions and make sure we provide answers to them. If Atone Siri is there, the moderator of this panel, she can pick up from here. Siri, can you unmute your mic? We can't get you.
Adam, please, you can also unmute him since you are the host. If you do, there he's going to have some kind of indication on his laptop to do that.
Yeah.
You're muted as well.
Okay, thank you very much, Manu, for taking my place. I'm sorry for the late coming. Hello, everybody. Thank you, Cynthia, for the wonderful presentation. We are going to move to the next speaker, which is Ms. Chi Naomi. Ms. Chi Naomi, are you there? Hello? Are you forgetting me, please?
Yes, Siri, we can hear you loud and clear.
Okay, thank you very much. Ms. Chi Naomi, are you there?
Yes, I think her presentation is ready.
Yeah. Okay. All right. Ms. Chi Naomi will be... Sorry?
Just give me...
Yes, Siri, you can present the presenter, Chi Naomi.
Naomi, we'll be talking on the contribution NGO owners to the different ways to which African countries can work towards achieving access to health services for Africans. So presentation is ready. We should listen to it. If you have questions to ask at the end, we'll give you the opportunity to ask your question, or you can type them at the chat box. So Naomi, over to you.
Please, while Miss Chinaomi is preparing, can we all unmute our mics if we are not talking? I see here Joel. Joel, please, can you kindly unmute your mic? And all those who are not speaking.
They should mute their mics, not unmute.
They should mute, sorry. Please mute your mics.
I'm Naomi, represent Buffer Research Foundation. I'll be presenting on NGOs and their contributions to African countries and workforce achieving access to non-governmental organizations providing access to health services. NGOs are with the aim of improving health sector.
Please, can we take a mic? We can get the presenter, please.
World Health Organization has acknowledged the increasing presence of NGOs in countries around the world, where NGOs focus on health service delivery, raising awareness and prevention campaigns. And according to the non-NGOs Code of Conduct to Health System Strengthening, NGOs are expected to hire practices that ensure long-term health system sustainability, to act as advocates, and to support ministries of health in many countries to ensure community engagement. In Africa, both local and international NGOs achieve this by establishing sustainable primary healthcare systems that address the most prevailing health problems, which include malaria, maternal and child mortality, sexually transmitted infections, HIV and AIDS, diarrhea disease, and accidents. And to achieve this, they link up with promotion of community participation. They have close links with the poor. They have committed staff. They establish healthcare institutions, fulfill health and social needs of vulnerable local communities and populations that deal with specific health problems like sexual abuse and rape. They also carry out promotion of health rights and executing preventive health programs. The objectives of this study were based on two things: to identify how NGOs have contributed to healthcare, WASH, and shelter in different African communities. The second objective was to identify the different activities NGOs have carried out. Ten different studies carried out on the contributions and achievements made by various NGOs working in different African communities. Criteria for selection of NGO was that the NGO was supposed to be either a local or an international NGO, and should have carried out health interventions in at least one community in Africa. NGOs included in the study were Médecins Sans Frontières, Norwegian Refugee Council, Integrated Health Organizations, National Refugee Committee, protests from the city, prompting Beijing to clamp down on the semi-monetary.
Please, we can't get the presenter.
People benefited from their WASH program. The findings of this study were classified into two topics: the health services and wash, hygiene, and sanitation, as well as shelter programs. The findings of this study were classified under two main areas: health services, wash, and shelter programs. In South Sudan, NGOs have been able to contribute to 52.9% of the country's health budget. NGOs have employed 1,390 health personnel. They have provided over 70% of curative health services, supported 89 public health facilities, established 24 health centers in IDP camps, and 20 health centers across North Darfur. In the year 2010, Medicine Sans Frontières built a treatment center which responded to 150 patients per day and treated over 7,000 patients suffering from the Kala-Azar disease in South Sudan, which recorded almost a 100% successful rate. Together with the German Leprosy and TB Relief Association in Nigeria, Red 8 was able to provide 186 artificial limbs to amputees in the Enugu state. She also provided health personnel with protective equipment against coronavirus to workers in hospitals who stood at the front line. In her regular activities, Red 8 does community health education to raise awareness on neglected tropical disease and their methods of prevention. In Cameroon, in the year 2018, IHO did free HIV screening for over 110 participants in the Boya and Ekuna municipalities. She successfully treated over 335 people. She successfully tested over 335 people for blood grouping in the Boya community. As per the wash and shelter activities, over 280,750 South Sudanese received help assistance from NRC in the year 2019. 66,979 people benefited from their education program, and 167,390 people from their and 93 people from their wash program. In the year 2019 still, over 855,000 South Sudanese received assistance from the Norwegian Refugee Council, and 134,762 people benefited from their health program. Medicine Sans Frontières, on its own hand, set up a water distribution scheme and introduced a daily water supply which served populations during the outbreak of the Kala-Azar disease. The Sudanese Red Crescent, which is a local NGO, works in partnership with the Red Cross to provide shelter, hygiene, and sanitation materials to over 680 households in the Abshur camp in Sudan. Meanwhile, in southern Darfur in South Sudan still, the Norwegian Refugee Council was able to provide basic household goods and made daily supplies of over 300,000 liters of water to the displaced populations, which served more than 8,300 households. We can therefore say that, irrespective of the geographical location, financial status, or the population's health needs, NGOs are a backbone for African countries to achieve access to health services for all Africans. Their activities go a long way to help many African countries gain access to basic health services, which address their most important needs. NGOs are the leading groups addressing the needs of most of Africa's population, especially in the midst of crisis, where they stand at the front line. To conclude, we will say that through wash, shelter, and health services, there are numerous ways in which NGOs contribute to achieving health for all in Africa. NGOs do this by improving and establishing the capacities of health units in existing health care facilities. They provide food, wash, and shelter materials to displaced populations. They carry out immunization and community sensitization and disease prevention. And they provide counseling and mental health services to populations in need. This study was, however, limited to the fact that it included just 1/4 of all African countries. So for future research, we would suggest that studies should include work done by NGOs in all African communities, most especially the work done by local NGOs in particular. For the value of this text, we will say that the findings of this paper show that NGOs have an important role in the health systems of different African communities in which they carry out health interventions. They provide curative health services that works towards achieving access to health services for all Africans. Thank you very much for your keen attention.
Thank you very much, Madam Naomi, for this wonderful brilliant presentation. As Africans and as NGOs,
Naomi representing the FAFA Research.
okay. Thank you very much, Ms. Shi Naomi, for this brilliant presentation. So, based on her presentation, as NGO owners, what have you done for Africa to achieve this health coverage? What have you done as a community in your community? You have an NGO. What have you been doing all along for Africa to achieve, or for your community to achieve universal health coverage? So, thank you very much for that brilliant presentation. We are going to move to the question and answer session. And please, if you have a question, you can raise your hand or you type in the chat box, and you should address the question to the presenter so that you hasten up answering session. Thank you very much. Any question, please?
Siri, I think there is a question already on the chat section.
Okay.
A question for Mr. Che.
Okay.
Okay, Mr. Che was asking, his question was directing to Ms. Ada, the first presenter, and he was asking, as a health student or a young Cameroonian, what role do we have to play to ensure a universal health coverage in Cameroon? So that's the question he addressed to Ms. Ada. And we thank already Ms. Law for the suggestion, for the answer she proposed. But we also want to hear from the presenter what she can say about this question.
Okay, thank you very much, Mr. Chair, for the question. Thank you very much, Madam the moderator. And thank you very much to the co-host and all our participants. Well, for me personally, the answer to that question is, the key to answer that question is volunteerism. You don't need to be an NGO owner. You don't need to be a policy maker. You just need to have the community at heart. That is why when I was presenting, I made mention of community health workers. Use your skills to give back to community. Serve, volunteer. That is the key. Because as a young Cameroonian, you cannot but tell me that you have not bypassed any of those people in the rural communities, or you're not surrounded by people. The question you should be asking yourself is, how am I using the knowledge I have gained, well, in whatever domain or in whatever field you studied, to help my community, to help the people of my immediate surroundings? How am I contributing? How am I helping them? Because like I said, universal health coverage, even as much as it's just health per se, health is holistic, meaning social well-being, psychological well-being, and all are considered. We just passed COVID-19 period. Ask yourself as a youth, how were you helping in this COVID-19 pandemic? Were you spreading false rumors, or were you encouraging the community? So like I said earlier, the simple key to answer that question is volunteerism. Volunteer your services. Make yourself available to the community, help them when needed, provide the information you have in your head. And just to mention a few, there are so many people that are doing great works out there. They are not NGO owners. They just have the community at heart, and they are doing marvelously well for the community. So key is volunteerism. That is just my simple answer to that question. Thank you.
Thank you very much, Ms. Ada, for that response. And I hope Chair has gotten his worry clarified. Any other person with a question, please? Hello, are you getting me all?
Yes, I can get you.
Yes, we can hear you.
Question. That means our presenters did a great job. Okay, thank you very much for the presentations. And I believe that everybody here has been clarified on how they can help achieve universal coverage in their community and in Africa. So in the absence of any other question, we are going to move to the next part of this webinar. Okay, there's a question here. Thank you, Mr. Okay, it says he wished to find out from Ms. Naomi, what are the motivations our government are giving these NGOs? So, Ms. Naomi, this question is going to you. What motivation is the government giving the NGOs? Ms. Naomi,
Okay. Since Miss Naomi is not present and I worked with her on the presentations, Madam the moderator, please can you repeat the question for me?
okay. Okay. Mr. Zanga wants to find out what motivation the government is giving NGOs.
Okay. Thank you very much for that question. I think it's a very important question because it's key to whatever we are discussing. Okay, first of all, like the name NGO, NGO means non-governmental organizations. It means that most NGOs are working separately, but in collaboration with the government, which often means that most of the programs held by NGOs are funded by them and their external funders or external bodies with collaboration with the government, because before you get an external funding, definitely the funder must have passed through the government to be sure that you're maybe registered to be able to be eligible for such a funding. Now, permit me say it as blank as it is. Oftentimes, the government doesn't really give so much support to NGOs. And this is another critical lapse in why universal health coverage has been delayed, because NGOs are the middleman between the government and the community. NGOs are the middleman between the hospitals and the community. So the reason why sometimes NGOs refuse to go down to those rural regions are because they have very little or no support from the government. Now, I'm not saying entirely that the government doesn't support NGOs. I'm saying that the collaboration or the support oftentimes is not equitably distributed, meaning some people are funded, others are not funded. Do not ask me why, because I'm not a government official and I don't know how they choose or the criteria they choose to fund the people they want to fund. But I can tell to you as an NGO owner in Cameroon that most of the programs that we carry out are without government funding. Without government funding. That is why it's so difficult sometimes to carry out certain operations, especially in those rural communities, even if you want to. Because first of all, you don't have so much financial support from the government to be able to go down to those regions. And also, you don't even have intercollaboration between NGOs themselves. Because sometimes the bigger NGOs, if I would choose to say so, the ones that have been on the ground for years, they don't want to belittle themselves to come down to your level. So it's all about a problem right from the roots. Before we quickly cast the blame on the government doesn't support, I know many NGOs in Cameroon that when you talk about such projects, as long as you don't talk about what they're going to be benefiting, they are not interested in collaborating in those projects. So the government has failed, NGOs have failed, we have failed. Now the question is, how do we pick up? What is the way forward? With or without government funding, what is the way forward? So that is the best answer I can give you.
Okay, thank you very much, Ms. Ada. And we have Madam Justina. She says she wants to add to Ada's contribution. Madam Justina, over to you. Madam Justina, are you there? Okay, in the absence of Madam Chilaka Justina, I wish to verify if Ms. Danga.
Oh, I'm sorry, I stepped aside. I wanted to add to your contributions concerning NGOs. It's actually an interesting topic for me. I've worked in an NGO in Nigeria for 5 years before coming here. So your contributions are really important and they are nothing but the truth. Because like the NGO I was working with, I can say that NGO is very vital and is very important to have as many as we can in Africa, because even some of the NGOs, they contribute to people in the rural areas more than even what the government have done. Like my NGO, it was not funded by the government. It was just one man's effort who have lived all his life in Hamburg, Germany here. And he was so poor. He's a man who his mom cannot even pay his school fees. He was rejected from school. But while he was thrown out from school, at the gate of the school, he said, God, I am from a poor home, from a poor background, but if you will visit me, if you will bless me, if you will make me go through school, then I am going to give it back to his people. He owned a freight forwarding company then in Nigeria, and at his retirement, he set up an NGO. This NGO has done a lot for the people of Niger Delta. He has done a lot for the people of Baptist in scholarship education, in health system, in community development, in taking people, especially people who don't even have the hope of seeing another part of the world. We take them to holidays in Dubai, and this NGO has really affect a lot of life. The sole purpose of this NGO was for the indigent, and this has been done. I'm encouraging your point you made that, and there are vast impact of NGO in Africa, and we should really encourage others to set up more. And even in Cameroon, according to someone that asked how the impact of NGO can flow in Cameroon also. Thank you very much for the interesting topic. Thank you, because this is actually also my line, and I appreciate and I'm grateful that I'm in this seminar today. Thank you.
Okay, thank you very much, Madam Justina, for that wonderful contribution. What have you contributed in your community? As you have an NGO, you just like waiting for the government to chip in something before you carry out a project?
Madam Moderator, I have a question, if you don't mind.
Okay, please.
Can you get me?
Yes, please.
Okay. Yeah, I came late. Probably I didn't get the presentation from Ms. Ada, but maybe this should be like a contribution. Like, we are talking about universal health coverage in Africa. Like, what are some of the? This is Ms. Ada.
For asking your question. Sorry for interrupting.
Okay, this is for Ms. Ada. Universal coverage didn't start today. It means in Africa, some countries have been making progress on universal health coverage. I think if we have to move forward, we have to look at some of these countries that have contributed positively or that has improved positively when it comes to universal health coverage. Now, we are talking about Africa. Not all the countries have the same standard when it comes to universal health coverage in the respective countries. So I'm asking Ms. Ada, which country, as of now, I don't know when the universal health coverage project in Africa started. So from when it started till now, which African country has made a progress? And if we all agree that the country has made a progress in respect to other African countries, what are some of the things other countries have to learn from these countries? Because probably we cannot use a one-size-fits-all strategy. Probably you cannot use a strategy in Kenya to fit that of Cameroon, but we can get the idea, the model that they use in Kenya, for us to know the limitations that they had and to adjust based on the Cameroon scenario and all whatnot. So I'm asking Ms. Ada, what are some of the development that are made in other countries and how we can copy this development and adapt to our respective countries? Thanks very much.
Thank you very much for your question. Ms. Ada, are you there?
Okay, that's a very good question. As aforementioned, I spoke about certain countries like Rwanda, Nigeria, Kenya, and Ghana. But with respect to your question, the top country that is leading right now is Rwanda. And I want to give a big shout out to all the Rwandans in the house. You're doing a great job. Okay, now, why is Rwanda prospering more? Or why is Rwanda achieving so much milestones with respect to universal health coverage? The very first thing, Rwanda, this is according to scientific journals that I have come across, Rwanda enforced compulsory enrollment into public and private health insurance schemes. Okay, what is making Rwanda succeed a lot is due to their national insurance policy that have been effectuated. And now, how did they make it happen? They had to make it compulsory. They had to make the citizens understand that the health is in their hands. There's even a statement I read where the Minister of Health at the time was refusing funding because when they launched the national insurance scheme, in a certain part of the village where there were funding bodies, the funding body said, okay, fine, we are going to take over the payments for these people. Since they were expected to pay something small and register for those health insurance schemes, the funding body said, okay, since we're already in charge of this community, fine, we're going to cover the charge for the indigents of this community so that they can get enrolled. And the Minister of Health refused. Why did he refuse? He made a very clear statement. You're just a funding body. You're not always going to be present. So allow the people to take charge of their own health. Allow the people make the decisions for themselves. And I think that is one great strategy that made this policy work in Rwanda. Okay, the indigenous had to take charge of their health, meaning they had to first of all see it as their own. They had to conceptualize the entire process that this national health insurance is just for our own. It's meant to benefit us. Also, taxes were shifted from other purposes in the government and diverted towards health, towards this national insurance policy. And I also made mention of the fact that Rwanda is small. The geographical area is relatively small. The number of people are small compared to countries like Nigeria. So even if the strategy worked for Rwanda, it may not be the same for Nigeria. In Rwanda, they speak one language, I suppose, a common language. But take, for example, in Cameroon, we don't have a common language. You go to the communities, there's so many different languages. You go to Nigeria, the same thing. So their one language or their common language was also a unifying factor, which made it easy for them. Meaning community health workers did not have to start saying, oh, I don't speak this language, I don't speak that language. All of them understood the same language. So it was easy for this health information to be sent out, and they invested a lot in health communication. So what am I saying? The national health insurance policy in Rwanda has worked. It is working even presently. So many people are benefiting from that health insurance policy. So if we have to copy it, even if in Cameroon, I think there's already that there are things in Cameroon that are already been effectuated also. We have the one of, I cannot remember the exact name, where the more people you enroll in the hospital, the more that the small amount of money or something per that person that is enrolled. Okay, so Cameroon is also making use of something like that. They're also making use of insurance schemes, but like I mentioned, the citizens in Cameroon, I'm talking for Cameroon because I'm from Cameroon, either they are not aware of those insurance schemes or they're not even willing to enroll in those insurance schemes, meaning there is a deficit of communication. The communication is not going around. The reason or the raison d'etre for us to enroll in national schemes, national insurance schemes, have not yet been made important to the eyes of citizens. So that is what I have to say. Rwanda for now is on the top of that list. And irrespective of what Rwanda is doing, another key thing that Rwanda is doing, they're using drones. drones to spray mosquito-infected sites in rural communities, communities that cannot be reached by community health workers. They're using drones to penetrate those regions. So what is Cameroon doing? I'm speaking for Cameroon. What is Cameroon doing? What is Nigeria doing? From wherever you're watching from, what is your country doing? So we have to learn from them. You get the idea from them, you try to conceptualize it, you try to make it work for Cameroon. So that is just it.
Wow. Thank you very much for the brilliant response.
That was a good one. At least the bottom line is, from what I got from you, the bottom line is there should be what we call a political commitment if a country has to actually succeed in some of these things. Because when you keep mentioning Rwanda, I think the Rwandan government accepted universal health coverage and they invested in it, and they are succeeding alongside their population. Thanks very much. That was a good one.
Thank you very much, Mr. Joseph. Do we have any other questions, please?
Yes, I have a question. It's just a follow-up question because we've spoken about the centrality of the government in achieving universal health coverage, especially when it comes to public policy. Now, the question I want to ask is, what if the government is not that supportive? Are we going to do because the government is not supportive, or what are we going to do?
Okay, please, can we mute ourselves and allow the person asking the question to be? Okay, thank you very much for your question. Mr. I presume this question is going to you still.
Okay, this the question again. I think somebody was talking when he was talking, so I didn't quite get the question in its entirety.
Okay, the question I ask is this: we know that the government is very important in achieving universal health coverage. Now, if the governments, like for example in Africa, are not very supportive, which other strategies can we adopt to go about this?
Thank you very much. That is a very good question. Okay, the government is not being supportive. Fine, we agree. I was talking to a fellow colleague of mine in Nigeria, Mr. Moses, I think last week, and he made some mention of something that really touched me. An inter collaboration between NGOs in Cameroon. Trust me, there is no such thing. I've not seen a firm where we say we are having a national NGO Congress in Cameroon, where NGOs from different regions get to come together. There was one time in the Southwest where the Regional Delegation of Public Health had a very good initiative. They said, okay, let all the NGOs in Southwest come together. Let all the health NGOs in Southwest come together. There are so many of them. Let's come together, form a coalition, okay, of NGOs in the Southwest, health NGOs in the Southwest, come up with an MOU, draft it, send it over, and let's see how we can work together as NGOs in health in the Southwest. And lo and behold, on the day of the meeting, just 2 of us were there. As shocking as it is, just 2 people attended from 2 different organizations, myself and the founder of Aging and Health Foundation, Genevieve, were the only 2 people present for that meeting. And the reasons or the complaints we got from different people were, if I come and say my idea, the bigger NGOs will steal my idea because they have the funding. So if I come and say my idea now, those big NGOs would engulf my idea, use the finances they have, which I don't have, and implement my ideas. And that is a problem in Cameroon per se. NGOs are not willing to work together. We are not willing to come together. We are not willing to put our sides at differences. We are not willing to put community at the center of it all. We are all pushing our self-interest, the funding, going for money, forgetting that the reason why you were even made an NGO, especially in the health sector, is for community. So if government is not willing to collaborate with us, what are NGOs themselves doing? We need to come together as one, because together we are stronger than one NGO penetrating the community. So before we, like I said, before you start throwing your eyes on the government, we need to build trust. We need to build a union among the NGOs in Cameroon. That is the fastest way to achieve universal health coverage in Cameroon, and maybe same for other African countries that don't have this kind of coalition. We need to start trusting ourselves. Whether you've been in the field for 15 years, it's an opportunity for you to groom the younger NGOs that are coming up. If you've been in the field long enough, instead of you using your finances to swallow up their ideas, why not train them? Why not mold them? Why not work together with them so that we can achieve better? So that is my answer to you, Ransom. If the government is not helping, the NGOs themselves are not helping. But I can assure you that if NGOs come together, with or without the government's help, things are beginning to change. Things will be, in fact, things will move. So many things will be achieved. So much progress will be made if NGOs can just set aside whatever they have and put their minds together and work as one for the benefit of community. If you know me very well, whenever you come to address me for partnership, I always tell you, if community is not the center of it all, please don't involve me. If your focus is not community, don't involve me. Because it becomes a certain point where you ask somebody for collaboration and the person is like, okay, so how much is involved? How much are we gaining? What's my benefit? How can you be talking about benefits when you're talking about community health? It's true, it's good to benefit, but you don't even ask me how the community will benefit. The first thing you ask me is how you're going to benefit. Make my logo big. My logo should be there very large. We've missed it all. So before we blame the government, NGO owners, let's come together and start working together. And the government will see reasons to support us, I believe. With or without their support, if NGOs can work together, we'll achieve so much. Thank you.
Thank you, Ms. Ada. I believe Ransom have benefited from your question. One listener says, if government are not ready to support communities, can also cities and
I think I have
communities
another. Okay.
vital in NGO development. Thank you for that contribution. Yes, please.
Madam Doctor. Okay. Select another person.
Yes, please.
Please, can I say something with respect to what Ada just said?
Yeah, Madam Moderator, can you get me?
Okay. I'm getting you.
Yes. What I want to say is that.
Mr. Let me give the floor to Mr. Langa.
Perfect.
Okay, thank you, Madam the Moderator, for giving me the floor. Madam Ada just raised a point about the collaboration of NGOs in Cameroon and the Southwest region specifically. I think that with the coming of COVID-19, the ball game has turned around, and I happened to have been privileged to attend some of the coordination meetings being held at the Regional Delegation of Public Health with other NGOs that are present in the Southwest region. It's kind of every Tuesday they come together to evaluate what has been done so far with respect to COVID and what are the different activities that the different NGOs are working on. And there has been a collaboration to an extent that the different NGOs come together, they kind of evaluate what has been done so far, they look at the gaps that are existing, and they look at the various communities in which the different NGOs are rendering support to, and they kind of try to see if the support should be scaled up or maybe resources diverted to another aspect and so on. So I really think that maybe that used to be the situation yes, but with the coming of COVID, I don't know if it's changing. NGOs are actually coming together. They have a delegation of public health, and to a certain extent, I can see a lot being achieved on that platform. So thank you very much.
Thank you. Oh, okay. Mr. Joseph, can you speak up, please?
Okay, thanks very much, Madam Moderator. This is just like a follow-up of what Ada was saying. Ms. Ada, This is a problem. I want this question goes to Ada. Sometimes anyway. I want to appreciate and thank you guys, the IHO, for doing a very good job down there in Cameroon. You guys are really doing a good job. This question goes to you. We keep talking about NGOs. Nobody is talking about these fraudulent NGOs, these quacks who receive monies from international organizations in the name of trying to do good work or the health stuff in Cameroon. I'm talking about Cameroon because that's my country. And at the end of the day, no accountability. Nobody's talking about that. IHO is a very good NGO. At least some of the works, I've been seeing them on Facebook, on their website, and or whatnot. But this is the problem. The problem is, I will call him or refrain from calling him because there was one time this universal health coverage organization or something, NGO, moved from hospital to hospital, trying to register patients, selling them the idea about you can insure yourself, and each time you come to the hospital, consultation is going to be free and all whatnot. All you just need to do is just to pay 1,500 francs CFA every month. Anytime you're sick, your family is sick, you come to the hospital, it's going to be free, and they are going to subsidize the drugs that you're going to buy. But to my greatest surprise, sometimes when these people come with those cards that, hey, I registered with this organization, they were talking about covering the health coverage in the hospital. When you come, consultation is free. Sometimes these patients, they keep arguing with nurses and probably doctors because they were sold the idea that when they pay money, they will come, consultation is going to be free, and their drugs is going to be subsidized. But that's not the case. So I don't know who these NGOs sometimes, who are they accountable to? Like, what are their credibility? What are the transparency? We need to know, because even if we say universal health coverage and I give 10 billion francs to IHO, we need to see work done. We don't need to say, okay, IHO is everywhere on Facebook without showing anything. We need work done. Work has to be done. So it has to come from our own end too. So what are some of the progress they are making and the transparency of some of these NGOs who take money to foreign organizations and don't do their jobs? Thanks very much.
The comment is so much, and I think we need to move on. Madam Ada, please respond to his question. I think that would be the last question. It's rather unfortunate that the others will want an answer, but we are running out of time.
Okay, just to say, any other questions regarding this topic, you can just note it down at the end of the session, especially during the open debate. We would be able to address your question. But for now, since we have a lot of presentations, we'll be running out of time. So we have a lot of presentations to take. So after I give an answer to this question, then we'll move to the next session. So since Chi Naomi is present on board and she did a presentation on NGOs, I will call her to answer the question. So Chi Naomi, if you're there, please, can you?
Hello, everyone.
Yeah.
Hello.
Hello.
Hello, everyone.
Hello.
Hello, everyone.
Hello.
Yes, you cannot hear me.
Go on with the response.
Okay, please can you just give it? Also, please can you just give a brief of the question again, please? Just a brief.
Okay, I'm talking about accountability with this
Hello.
NGO. Yeah, can you get me? I'm talking about this NGO. Who are they accountable to? Like, yeah, hello?
Okay, I get you talk about accountability.
Yes, credibility,
about NGOs,
transparency.
NGOs.
Yes.
Okay, first I would go back to the creation of NGOs. I would like to say that even when NGOs are created, there is usually a statement that stipulates what they are bound to do, the limit and the extent to which they can carry out activities and the various things they are supposed to do, especially international NGOs. I think they have this scenario where they have this common meeting just to do a check, since they have common activities which they carry out in communities and in countries. So I would say they are self-accountable. And also accountability would be to the members of the NGO in my own
Work is breaking.
Okay, just to add to what Naomi was saying, when it comes to accountability, like she aforementioned, you have to talk about when NGOs are created. When you go to register an NGO, you register an NGO, there is a process. For example, if you're registering a health NGO, you are registered under the Ministry of Public Health, the regional delegation of public health where you find yourself. Now, to be very sincere with you, I think maybe with the advent of COVID, they are beginning to monitor a lot of things. But before, it's really difficult because so many people go to the communities in the name of a certain NGO, okay, and they scam people. Now, let's be real. Scam always exists, no matter how much we try to play with the system. There's some people that always look for a fraudulent way to give NGOs a bad name. It has happened, and it's not just restricted to NGOs. You found several microfinances that have opened, swallowed people's money up, and disappeared into thin space. But now, I think this is a call for reawakening, for strict measures. Like I said at the beginning, there are policies that are made, but implementation is the process. Is the problem, sorry. Implementation is the problem. There is no strict implementation on how to follow these NGOs up to know which is wrong. For my basic knowledge, when you go into a community, like for example, when we used to go to communities, the chief of those communities or the heads of those communities ask you to present a paper. You're supposed to present a paper showing that you're in collaboration with the delegation of public health for your region before you even begin to effectuate anything. So it means that those people who were carrying out those scams, if they were able to have such an authorization, it means they were forged. Now the question is, they were forged for how much? Trust me, there is bribery and corruption right inside the sector. So they were forged for how much? And it's not going to be news to hear that people have gone to open NGOs because they wanted funds. So the question is, those that are administering the opening of these NGOs, are they actually respecting the guidelines that were given to them by the Ministry of Health? That is the first thing you should be asking yourself. So before you fall prey to any scam, before you fall prey to anybody giving you anything, especially when it concerns money, please do your findings. It is also your right as a citizen to do your findings. It is your right to ask the questions that you need to know and dig up whatever information you need to know to avoid being scammed. So I cannot assure you that the scam is going to end, because there are people who always find a way to maneuver their way through such practices. But as a citizen that you are, and you're aware of these procedures, do your own path and try to ensure, dig out information as much as you can to find out that they go through the legal process. But these scams are real and they exist, I must say, but implementation of those policies, it's usually a big problem. So thank you very much. I think we'll be moving to the next presentation.
Thank you very much, Ms. Ada, for the response. Please, if you have a question, you can just drop your question in the chat box. And I'll be handing over to the next moderator, Ms. Parvin, for her to moderate the next session of this webinar. Thank you very much, and let's stay focused. Thank you.
Okay. Hi, everyone. Good afternoon, good morning, wherever you are from. Hi, everyone.
Hello.
Hi.
We can hear you.
Hello, Parvin. We can get you. Good morning.
What's happening?
Good morning, wherever you're from. Hello. Welcome. Okay. The second session of this program. Wow, the second program is really amazing. I've learned and answering session. It has been wonderful. I really want to appreciate what said. Right now, what is allowed presenting on perceptions of mental health disorder challenges in
Okay, Ms. Palvin,
district.
your network is great.
So
Ms. Palvin, it seems your network is breaking. So we'll just ask Mrs. Manuela to take over from there and continue with the program, please.
All right, while we wait on Ms. Palvin's network to stabilize, I hope we're all getting me. She was to coordinate the second panel. The second panel discussion, which was going to run from 12:35 to 1 o'clock. I think we are on time, and I plead with us all to contribute, and let's all follow our time schedule. So going straight to the point, we're going to call on our next presenter, Mr. Nganga Jamin, who is going to take over this third presentation, and he will be talking about the perception of mental health disorders and challenges in the management faced by healthcare providers in the Boya Health District. Not to waste much time, if Mr. Nganga Jamin is there, he can take over, present himself, and go straight to his presentation. Jamin, if you're there, you can take over.
His presentation is ready, but I just want to please.
Yes.
Okay, before you go on, please just give me 1 minute. I just want to say that, please.
Okay, good afternoon, everyone.
Good afternoon.
Good afternoon, Jamin. I think Ransom had something to say. Please, can you give him 1 minute, let him address us before you proceed?
Okay.
Okay, thank you very much. Actually, the presentation was pre-recorded, but if he has pre-recorded, we're going to go on. I just wanted to say that, please, everyone should bear with us, that most of our participants are like in places where network is not very good. So we should just bear with the situation. And if you're not talking, please do mute yourself. Only unmute yourself when you want to say something, so that we can have some kind of coordination that is going to make us go to the end. And I thank everyone for being on board, and I hope that you stay until the end of the program. So over to you, Jamin.
Jamin, if you're getting us, you can share your screen and go on with your presentation.
Can you hear us, Jamin?
I've been disabled. Yes, I can get you, but I've been disabled by the host for sharing my screen.
No, you can share your screen. Check right now. You can share your screen. Can you?
Okay.
Yes,
I can.
Be able to share.
Okay.
Okay.
Good afternoon, everyone.
Good afternoon, Jamin.
Good afternoon.
Yeah, the host of this webinar, the moderator, ladies and gentlemen, good afternoon. Today we'll be talking on the topic, the perceptions of mental health disorders and challenges in management faced by healthcare providers in the Boya Health District, presented by Nganga Jamin, and this work has been supervised by Professor Ndeso Sylvester Atanga. We are going to have an outline that is going to run from introduction right down to references. What is mental health? Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution like psychosis, schizophrenia, depression, was punishment in some communities in Cameroon, as reported by HECO and collaborators in 2015. Treatments are available, but nearly 2/3 never seek help from health professionals. This could be attributed to reasons such as stigma, discrimination, and neglect. Community-based and primary healthcare services are better in providing mental health services as reported by the Mental Health Action Guide Program in 2017. So what necessitated this study was the fact that the two recognized centers for the management of mental health disorders in Cameroon, which are La Quintini in Douala and L'Hôpital Jameau in Yaoundé, are not readily accessible and remain ill-equipped and understaffed for the management of mental health disorders. The few doctors who managed to consult have been trained in general medicine and not psychiatry. And to make matters worse, psychiatric nursing has been poorly implemented in the nursing curriculum. So our main objective was therefore to investigate the perceptions of mental health disorders and challenges in management faced by healthcare providers in the Buea Health District. And specifically, we sought to assess the level of knowledge and practices of mental health care in the Buea Health District. Secondly, to investigate the perceptions of the mentally challenged by healthcare providers in the Buea Health District. And thirdly, to identify the challenges healthcare providers in the Buea Health District face in the management of mental disorders. We carried out a 7-month cross-sectional study that ran from January to July 2020 in the Buea Health District, which has over 30 registered facilities housed in 7 health district. Our target population was, and we calculated a sample. With respect to our sampling technique, a multi-stage sampling technique was used, wherein all the 7 health areas were level, and subsequently a simple random sampling technique was being employed by 5 health areas were being selected, and convenience sampling was used to select 15 health facilities where our healthcare providers were selected based on the probability proportionate to size of each of the health areas that was being selected. Included in our study were doctors, nurses, psychologists, and counselors who gave their consent and who had at least 3 years of work experience. However, we excluded healthcare providers who were not doctors, nurses, psychologists, or counselors, who were not able to complete the in-depth interviews and who had less than 3 years of work experience. Regarding our data collection techniques and tools, participants were served with information sheet concerning were enrolled into the study. In-depth interviews were conducted and measures. Doctors included directors and heads of health facilities, while psychologists and counselors were heads of their respective departments. With respect to our study procedures, we started by obtaining an authorization from the Faculty of Health Sciences. Subsequently, we had a clearance from the Institutional Ethical Review Board of the Faculty of Health Sciences in here. We obtained authorization from the Regional Delegation of Public Health. Authorization was gotten from the directors and heads of health facilities in Buea, and finally, consent was gotten from the different healthcare providers. With respect to data analysis, our questionnaires were keyed into AP Info version 7.2.2.6, then into Microsoft Excel 2016 for data cleaning and analyze in the statistical package for the social sciences version 25. Descriptive statistics and regression analysis were then done, and our recorded data was transcribed into MENA Lite version 5.0 for analysis, and we did thematic content analysis wherein themes and subthemes were developed and quotations used to better explain our findings. Ladies and gentlemen, our results and discussion. Among the 300 questionnaires which were being distributed, 292 were returned, giving a response rate of 99.3%. It was observed that female participants were the most represented in our study, and majority of the healthcare providers were nurses, and it was observed that a greater percentage of the healthcare providers had work experience of 3. Looking at the 40% of the healthcare providers had a correct knowledge. Et al., who carried out a study in Kenya in 2005 in assessing the knowledge of nurses and medical doctors in mental health in Kenya, recorded a similar result. Also, looking at the practices of mental health care, 39% of the healthcare workers had a good practice towards mental health. A study by F2 et al. In Ethiopia realized even a higher prevalence of poor practice of 75% among healthcare providers. This could be attributed to factors such as poor communication strategies with the mentally challenged, medicalization of symptoms, referential courses for healthcare providers. After performing a logistic regression analysis, it was observed that educational attainment, work experience were independent predictors of good knowledge of mental health disorders. The odds of good knowledge on mental health disorders was high among participants with a master's level of education and participants who had 7 to 10 years of work experience. We have the summarized views of the healthcare perceptions healthcare providers do hold with respect to mental health disorders. One of the participants in our study highlighted the fact that he sees the mentally challenged as people who can be violent and aggressive, as he highlighted by saying that I am scared of someone with a mental problem, and when he or she, that the person does not think normally, and so I tend to be scared away. However, Fazer et al. In all mentally challenged individuals are violent and aggressive as opposed to popular opinion. Secondly, healthcare providers also perceived the mentally challenged as people who could easily be stigmatized. As this nurse stated, that I see someone who will easily be stigmatized by the family, friends, and the community at large. They may start looking at him or her like an outcast. So Goroja et al. In his study in Nigeria also highlighted a similar phenomenon whereby he indicated that most individuals in the community do not seek mental health care mainly due to stigma, discrimination, and neglect. Looking at their perception with respect to the causes of mental health disorders, some of the healthcare providers indicated that mental health disorders were caused by biological factors. Some were more holistic to say that these mental health disorders are caused by biological, social, and environmental factors, whereas some of the health surprisingly reduced the causation of mental disorders to witchcraft. So Leger et al. And Watson Jones et al. In their studies affirm the fact that biological factors, social factors, environmental factors, and even witchcraft and supernatural factors can coexist in the explanation of mental health problems. Looking at the challenges that these healthcare providers who face in the management of mental disorders, they highlighted the sufficient infrastructure, as this psychiatric nurse highlighted, that our patients are admitted in a medical ward, which makes it dangerous for other patients away. This is a major challenge. Also, they highlighted the problems, the challenge of insufficient trained mental health staff, and also they highlighted the problems of an existence of a gap in training. Like this medical doctor highlighted by saying that as a medical doctor, I cannot remember when I had a formal mental health lecture in school. You cannot train medical doctors and nurses without thinking about mental health in their curriculum, but this is not often done. So again, the healthcare providers also highlighted the fact that they receive physical or verbal assaults from the mentally challenged, and of a poor referral system with respect to mental health. So to conclude, correct knowledge and good practices regarding mental health care in the Boya Health District stands at 40% and 39% respectively. And healthcare providers' perceptions about the mentally challenged include seeing them to be seeing the challenge to be people who can easily be stigmatized, who are vulnerable, and who are violent and aggressive, and also unproductive. The challenges the healthcare providers do face include the absence of basic infrastructure, a poor referral system with regards to mental health, insufficient trained personnel in mental health, verbal and physical assaults which they receive from patients, and the existence of a gap in medical training. We therefore recommend that the training of medical personnel incorporate the aspect of mental health into their curriculum. Secondly, that the Ministry of Public Health should organize refresher programs and seminars annually to enhance knowledge and subsequently practice of mental health in its health system. And thirdly, the Ministry of Public Health should properly integrate mental health into primary health care, which is actually a key aspect in achieving universal health coverage. The last but not the least, that healthcare providers are encouraged to put off negative and prevent victims of mental illness. Some references. Thank you for it.
Thank you so much, Jamie, for the presentation. Even though network was an issue, you had quite an elaborate presentation there. And we cannot but hide the fact that mental health is of big concern in the industry today. And it was correctly said that in some few 2, 3, 4, 5 years to come, mental health will be the #1 killer disease. And we are already beginning to see that, especially with the advent of COVID-19, lockdown, and everything just becomes so complex up there. So thank you so much for your presentation. If the moderator, Parvin's network is stable, then I think we would like to I'll hand over the session to her. Parvin, is your network now clear? Parvin, can you hear me?
Yes, I can hear you.
Oh,
can
great.
you hear me?
Great, I can hear you 5 on 5, great.
Okay, we want to thank Mr. Jamin for that very good and straightforward presentation, very elaborate. And I must say that we are glad to have him. Okay, right away, without waste of time, can everyone hear me, please? Hello?
Yes, we can hear you.
Yes, we can hear you. Yeah, we can hear you.
Okay.
Yes, we can hear you.
Okay. All right.
Yes, Parvin, we can hear you.
Okay, we move straight away to the fourth presenter who will be presenting on knowledge. That's Mr. Kani Rigobel, who will be presenting on knowledge, attitude, and practices on malaria prevention amongst inhabitants of the Tam community, Kumba, in Cameroon. Please.
Just a brief correction, Parvin. The presenter is actually Miss Daga Miranda.
Okay, Miss. Sorry for that. All right, we move straight forward to Miss Daga Miranda, who will be presenting on knowledge, attitude, and practices on malaria prevention amongst inhabitants of the Tam community, Kumba, Cameroon. So over to the presenter.
While Miranda prepares, if there's any question pertaining to Jamin's presentation, please make sure you drop it at the chat section so you don't forget.
If Miss Miranda is having problems with her network, as earlier mentioned by Mr. Ransom, we already have a recording of these presentations in case we had situations like these, because all of us know that back in Africa, sometimes network can be an issue. So I think I will just move straight away to Mr. Ransom. Okay, Miranda says she's connected.
Yes, I'm connected, please.
Great, great. Can your network carry the presentation?
Yes, it can.
Very good. Very good. So please move on right away to the presentation. Thank you.
All right, thank you very much. So I'll be presenting on the knowledge practices of malaria prevention, among the inhabitants of the Tam community. Okay, so let me just share the document.
Great, please share your screen with us. Okay, while Ms. Miranda is sharing her screen, please don't forget, if you have any questions, please drop them in the chat section. Okay, Ms. Miranda, maybe it would be better if Ransom just plays the audio to save us some time, and then you can give 1 or 2 words at the end of the audio, okay? Great, Mr. Ransom, please, over to you. Thank you so much.
Just a minute.
While he's doing that, please don't forget to edit your names to one of your names and the country of origin, like for example, Cynthia, Cameroon, so that it helps us to better know the diversity of people we have in our forum today. And once more, thank you. Keep engaging in the questions, all the sessions. Thank you so much.
Good day, everybody. I'm Daga Miranda, a representative from the Brains Association from Buea, Cameroon. I'd like to start by thanking our amazing organizers as the Integrated Health organizing this amazing webinar. And of course, all our viewers all over the world, thank you for your attention. So I'll be talking on the attitudes, knowledge, and the practices on malaria prevention in Africa, particularly in Cameroon, in Kumba, and the Tam community. First of all, what's malaria? Malaria is an acute febrile disease which has signs and symptoms such as headache, body malaise, body pain, and fever. Of course, he has other presentations, and it's really a call for concern because he has a very high morbidity and mortality rate. Morbidity, that's disease rate, and mortality, that's death rate. In Africa alone, we have 200 million cases. In the world, we have 228 million cases, meaning that Africa occupies 95% of the disease cases. So it's really a call for concern because many people are dying of malaria. So we have about 400,000 million people dying every day of malaria. And in Cameroon particularly, we account for 25.5% in Africa as a whole. So of course, malaria is common among children because they do have a very weak or not fully developed immune system. So this research was carried out in the entire community, and we chose mostly adults from each household to come and give us their thoughts and everything on malaria to be able to better assess them and know how to help them. So there are 4 species of malaria types. We have the Plasmodium malariae, Vivax, Ovale, and Falciparum, sorry. And the most deadly among all of them is Falciparum, deadly and most common. So we also noticed that if we're able to prevent the vector, that's the mosquito, from biting the population, we'll be able to greatly prevent the spread of malaria and of course eradicate malaria completely. So our objective, first of all, was during the research is to assess the community on their knowledge on malaria and to be able to know how much they practice the prevention of malaria. So as study design, we used the community, we used a month, and we chose an adult from each household in the entire community. We were able to get a total of 295 participants, 218 which were male, and we were able to get 87 which were female. Most of them, we noticed that they ended up with primary level of education, that's it, they weren't able to get to the higher level of education. And of course, notice that most of them were farmers, and very few of them were pastors and carpenters. Some of them were traders, others were teachers, others were nurses or health practitioners. And from what we got, most of them know what malaria is. They know what malaria is and they know how to prevent the malaria. So we're able to get a total of 85% on those who knew what malaria was. On what causes the malaria, very few of them knew what causes the malaria. They didn't know the exact cause of malaria. And how malaria was transmitted, that's of course through the mosquitoes. Most of them were aware of that. So we got a total of 74%. But now those of them who practice the prevention of malaria, there were very few of them. So they know how to prevent the malaria, but they don't practice it, such as using mosquito nets, completing their treatment when they're already infected, clearing their bushes, clearing all dumps, keeping a healthy and hygienic environment. They didn't practice that. So what we concluded was that they didn't know what malaria was, but they didn't know the exact transmission method of malaria, and they didn't practice the malaria prevention. But they did know how to prevent the malaria. We had limitations such as access to those areas because of their very poor networks, and some households refuse to let go of their adults. You know how Africa can be, of course. What we recommend is that they'll ensure proper roads in areas in Africa so that the health personnel can be able to assess those areas. Of course, if they are sensitizing population of malaria prevention, they can't be able to get there if the road networks are not good enough. And of course, we want to encourage that they practice the prevention of malaria, because most of them do know, but they don't practice it. We recommend that the government or those in health positions will, of course, ensure the release of materials needed for the prevention and ensure that they do carry out all of these preventive methods. And of course, just to recall how to prevent malaria: clear your bushes, clear all dumps, keep a hygienic environment, one that cannot inhabit mosquitoes, and of course, get treated. Have knowledge on the treatment prophylaxis for malaria. Thanks so much for your keen attention. I hope you did learn.
Okay, thank you so much for listening. So that's the end of my presentation. I just want to add that for the prevention, most of us don't know what to do, but they don't practice what they are supposed to do. So of course, we want to ensure universal health coverage, especially in Africa. What we can do is to do constant follow-up on our relatives in our various organizations, try to do a follow-up on how far they're carrying out the prevention. For example, many government officials always send out materials such as mosquito nets. Some even give free treatment. But how much do they ensure that they do use how much do they ensure that the inhabitants use what they are supposed to use? So that's up to us individuals who are very much aware of what they are supposed to do. So, and of course, we try to encourage clearing of bushes, especially in village communities. We try to extend our health organizations to communities. Like if we have webinars or seminars that we organize, we try to get those in the community so they are aware of what they are supposed to do. And of course, most of them are farmers, so we try to encourage them on how to manage their farming. That's the seasonal farming, but they are able to manage malaria as well by wearing long sleeves. They should complete their malaria treatment prophylaxis and all of those stuffs. So that's it. Thank you very much.
Okay, back
Thank
to
you so much.
host. The host, you can please take over.
Okay. Thank you so much, Ms. Miranda, for the presentation. Thank you so much, Mr. Ransom, for facilitating the process. Please, can you stop sharing your screen so that I can see other parts of the chat? Okay, thank you so much. Okay, so we've had presentation from Jami, we've had presentation from Miranda. If you have any questions, please can you write it down in the chat section so we can discuss on these questions before we move to the open debate. Okay, somebody has a question. If you have a question, can you just unmute yourself or can you indicate with a hand show so that we can, it'll be easy for us to coordinate the question and answer sessions. You can just indicate with a hand show. Okay, we have Bless. Okay, Bless, please, you can ask your question.
Okay, thank you very much for this session and for the presentation. It's really great work done by the organizers and the presenters too. With respect to the last session, we've been talking about knowledge practices, and I think that's one of the things where in Cameroon we have so much data on knowledge and attitude and practices with respect to the diseases that affect us in tropical areas such as malaria, of course, and mental health, which is actually of really broad scope, but generally overlooked, because I think mental health is something, when we say mental health, you just think of one crazy person walking around, but there are other people who are otherwise look healthy but suffer from one or two mental health problems. So the thing I want to ask probably to the two presenters or any person who feels comfortable to ask the question is, I think research is building on knowledge, and they have already started with a good path. I think right now they are one of the most knowledgeable people in Cameroon with respect to the problems the communities face with respect to the problems they've addressed. So if they are given an opportunity to take their research further or to propose concrete solutions with respect to what they found out in the community, a concrete solution from the recommendations they have, what are they going to propose? Yeah, thank you.
Thank you very much. I think the question was thrown to either Jamin or Miss Miranda. So who is opting to take the question? Jamin or Miranda, which of you is going to take that question?
Yes, I think I'm available to take the question.
Okay, right on.
Can I ride on?
Yes, you can.
Okay, I think to start with, one of the limitations of my study was the fact that it was only carried out in the Boya Health District. And with such a study, mental health disorders, that are kind of a global phenomenon, a global health situation. So I think that if I was given the opportunity to take this study forward, I will start by maybe a regional study to actually ascertain what the mental health problems are in the Southwest region. Or why not even go national, do a national study to know the different prevalences of mental health disorders in Cameroon. And because it is about how, when you have those statistics, you can better put logistics into place. You can better know how to appoint personnel that can take actually take care of the mentally challenged. And again, I think that there are a few privately owned mental health institutions in the country. One I am versed with is the Babungo Integrated Mental Health Care for Humanity, and they are doing just too much. They are doing a lot as far as mental health is concerned in Cameroon. So I think that the government can motivate some of these privately owned institutions to make them even perform better and to scale up their capacity as far as mental health in the country is concerned. As you rightly said, Mr. Bless, it is not everyone you see that smiles with you, that puts on a nice suit, that drives a beautiful car, that you can see that this person is mentally healthy. Far from it. Mental health, for someone to have a mental health problem is not written on the forehead. There are a lot of those people that deep inside, they are having serious mental health problems. They are just so enormous. And I also the host of this presentation, she made a statement at the beginning that in the next 4, 5, 6 years or even 10 years to come, people will no longer be afraid of illnesses such as malaria or HIV/AIDS and all of that. Mental health will be at the top of the list. And with the advent of the sociopolitical crisis in Cameroon, mental health illnesses have skyrocketed. They have really increased. Post-traumatic stress disorders, depression, just to name but those, they are really on a high toll. And I think that the Ministry of Public Health, maybe with this study that we carried out, I think that we maybe proper implementation of the recommendations that are being stated by this study, it can just be a way of achieving universal health coverage, which we are talking about today. Thank you.
Okay, thank you very much, Jamin. Thank you so much. Miss Miranda, since it was addressed to you both, she said she had something to say. So can you be brief about that, Miss Miranda?
Yes, of course. Thank you very much. Just to add to what Mr. Jamin said, I think I have three recommendations for the government. The first is they should construct more better roads because most of these areas where they have the highest amount of infected people for malaria, they actually have there's very little access for medical personnel to get there and ensure the proper treatment of these people. So the first is to ensure easy access to every area. And secondly, I also want to encourage that most of these NGOs or any health program, the programs are being carried out even to those very communities because most of these programs end in the city areas like that. Communities in Boya where what happens in the village community, if you do get to, you'll be surprised that it does happen in this town. So most of the knowledge ends at the city level, it doesn't get into the communities. And of course, the follow-up of the people. For example, malaria prophylaxis, how much do they buy it and consume? Most of them end with their herbs and that cannot kill the malaria parasite in them completely. So when the government give out that treatment, they should ensure that they do finish it like how they do for people in the city or in the city area right there. So when they come for their malaria checkup, they give them drugs. They should do a follow up on how much they consume these drugs. When they distribute mosquito nets, they can do visits once in a while in those community areas and see how much those nets are hanging on their beds or how much they use them. And of course, as when they do their assessment, they should ensure evaluation or establishment of these particular ideas in these communities. Thank you very much.
Thank you very much, Ms. Miranda. Thank you so much, Mr. Jamin. We are going to take two
Adam, before
questions and
you
then
continue, let me just notify something. I've shared a link in the chat section Please kindly follow the link and fill in the attendance list with your correct order of your names. We are going to use this link, these forms like how can I say, to produce your attestation. So please indicate your names clearly. Everyone should please follow the link and fill in the required information. Thank you.
Thank you so much, Mrs. Manuela. It's really important that you fill in your names correctly, as you would love it to appear on your attestations. And I need not overemphasize that attestations like this can take you to places you really have no idea about. So it's a good attempt that we're trying to make sure that everybody that attends here has at least a proof that you attended such a webinar. Okay. We have 2 questions for this session, and then we'll be moving to the open debate right away. So the first question will be for Mr. Joseph. So Mr. Joseph, if you can hear me, maybe you can unmute yourself and ask your question, if it's to either of the parties, the presenters, or just one of them. So Mr. Joseph, if you're here and you can unmute yourself, please do so. Mr. Joseph, are you
Hello,
present?
everyone.
Hello, Mr. Joseph, we can hear you 5 on 5.
Okay, I am coming from an economic perspective now. You know, with all the universal health coverage stuff affecting the economy, it definitely is going to affect the economy. My question is, with all these now, how does the universal health coverage affects the economy in all these? Can someone tell me? Because I know there'll be it will definitely affect the economy, but I don't know from which direction that is going to be from. So can someone help me with that?
Okay, thank you so much for your question. How universal health coverage would affect the economy. Okay. Is there anybody that wants to attempt to say something before I say what I have to say? Is there anybody that is attempting to answer the question? You can unmute yourself and answer before I give an answer to that question. Okay, since there is no answer, to quickly just give a response, universal health coverage is definitely going to affect the economy. Why? Because to be able to achieve universal health coverage in Africa, you need funding, you need funds, you need money. So definitely what most policymakers are emphasizing or are encouraging government and other institutional bodies that are so passionate about universal health coverage is to generate more money, to tilt more money, or should I say remove a little bit of money from each sector and throw it into the health sector. For example, it has been encouraged that the taxes that are collected should be tilted more towards achieving universal health coverage. So if you're talking about how it's going to affect the economy, then we should start looking at maybe how government economical policies will be able to deviate or will be able to throw more attention or more light to issues of health. And I need not reiterate that COVID-19 has really taught us a very big lesson that health shouldn't be neglected, because we saw the shutdown of so many economies during this lockdown period, where you have the physical cash, but you cannot do anything with it. And so many companies were forced to lock down because they were not adequately prepared to handle such a pandemic. So universal health coverage to be achieved, more money, more finances has to be tilted into the sector of health. Now, there are different ways you can do that. You can talk about taxes like I aforementioned. You can talk about insurance policies. And like I mentioned in the case of Rwanda, it's not about imposing insurance policies on the cities, it's about convincing them, to make them understand that for them to invest in such a sector to their own benefit. So I'm not really an economics kind of person. I'm just saying it like from the broader economical view, how UHC is definitely going to affect the economies, especially in African context. Since we're talking about achieving universal health coverage in Africa, Africa needs to start tilting more of her budget into health. And you know, the funniest thing is there are actually policies that state about a certain percentage of money being tilted into the health sector, but that's just on paper, because in reality it's not happening. in reality, other sectors are being prioritized. So if we want to achieve UHC, this aspect of economy has to be taken into consideration, and governments, policy makers have to start looking for better ways of tilting funds, much more funds into the health sector. So I don't know if I maybe answered your question. I don't know if I attempted to throw some light on this question, but if I didn't do it, then trust me, during the open debate session, we are going to crush that question. So Mr. Joel, you had a question. So if you're present, can you unmute yourself, Mr. Joel?
Okay, good day, everyone.
Hello.
My question is this. I wish to find out what causes mental health, because here in Cameroon, we believe that when somebody is mad, it's as a result of witchcraft, and anybody who is mad, you just conclude to maybe the person stole something and he is bewitched and stuff like that. But I believe as a scientist, there is something that causes that mental disorder. I wish to find out what is it.
Thank you so much, Mr. Joel. It's a very important question. So, Mr. Jamin, I think this question goes to you because you just gave us a very important lecture on mental health. So, can you please answer the question from Mr. Joel?
Okay, thank you very much, Mr. Joel, for that question. It's quite a sensitive question, and I really appreciate you for asking that question. So you see, mental health disorders are very common in our community, and the causes of mental health disorders can be traced maybe into the origin of the families of the individual, biological factors. At times, these mental health disorders are being inherited from the lineages of people, and you see that the offsprings, they come up presenting with these mental problems. And secondly, these mental health illnesses are also being caused by environmental factors. Environmental factors here, for example, in Cameroon, we have the Anglophone crisis. And during the Anglophone crisis, a lot of people have lost loved ones, they have lost property, and that alone is a triggering factor that can push them into mental health problems such as post-disorder, depression, and all the like. And also, when looking at so in many in my presentation, I did make mention of the fact that in so many communities in Cameroon, mental health disorders are being viewed to be caused by witchcraft. Some see it as witchcraft, some see it as God's punishment, and all of that. So it's really a big challenge. It's really a big challenge that in our setting, a scientific explanation of the causation of mental illnesses is not being accepted. But the key issue here is to look at the causation of mental problems to be a genetic, to have a genetic origin, to have an environmental origin, an economic origin, and all of that. Just for example, the inability of a parent or a father or a mother to be able to provide for his or her family can be enough reason to be able to lead that father or mother into a state of depression, to a state of anxiety. So looking at mental health, we should look at it from a broad perspective. We should not narrow it down to some kind of witchcraft or God's punishment or so.
All right.
I hope I answered your question.
Thank you so much, Mr. Jamin. And just in addition, Ika Cameroon will also like to contribute to the answer. So Ika, if you can hear me, maybe you can just unmute yourself and quickly answer the question. Ika, can you hear me?
Yes, I can.
Great.
Okay, thank you so much. I just want to add to what Mr. Jamin has said, that some other causes can be inability for the individual to cope with external stressors. You know, sometimes some people, they have low self-esteem and they tend to isolate themselves from others. In a long run, you find them getting into depression. These are some of the causes that that predispose people to mental illnesses. Also,
imagine a scenario where one day, maybe relationships, you are with somebody, maybe a spouse, all of a sudden, maybe you are just from talking to them, in the next 5 minutes, you hear that they have an accident on their way to somewhere and they die. Many a times, many people fall into shock, and before they recover, you see that they have gotten themselves into some depressive states, or their health, their mental health is no longer the same as before. Let's not also forget that we are in a generation where the rate of involvement of youth into hard drugs is very high. Many a times, these hard drugs, they have an impact on our mental health. When we take such drugs, before you realize it, you are insane. And I think that's all. That's just what I can share for now.
Thank you so much. Just to add more, should I say, layers to whatever has been said. Honestly speaking, mental health is a problem. Mental health is a big problem. I don't know how you see it, but there are a lot of things that are affecting our mental health. And from time to time, we need to get it checked up. We need to always try to find peace within ourselves. Most often in Africa, we are in denial. We think we are not, mental health is just for the Western people. But trust me, there are a lot of things that are causing our mental health to not be okay. And there's nothing to be shy about it. There is no reason to deny it. There's no reason to resist and say, no, this kind of thing cannot affect me, or things like this. You just need to be open about it. Try to talk to somebody about it. Okay, we have another question from Miss Miranda. And she says, this is from Miss Atone series. She says, hello, Miss Miranda. In spite of the knowledge people have on malaria prevention, they still have bad practices on prevention of malaria. So what could be done to scale up prevention of malaria in our communities and delete these bad practices from the minds of people? So Miss Miranda, can you answer the question?
Of course, of course.
Thank you.
Okay, like I was texting on the chat box, most of these people don't have accurate knowledge on the exact effects of malaria, because if they do know, they will not be avoiding the practices. Most of them feel like if they feel malaria symptoms, they just cook their small herbs and they take and they are very fine. So it's on us now for us to give them the detailed explanation on how malaria can affect them. For example, I was texting on the chat box that they should always complete their malaria treatments when they are giving one. The herbs they consume are not exact, so they cannot really kill the parasite. So when we go to their communities to educate them, we tell them the exact things that those herbs cannot give them complete treatment, and then encourage them to finish their treatment. That's normally a 3 days treatment on malaria, else they end up in hospital or they get dehydrated and the other effects that follow malaria. And of course, detailed education, most of them can actually understand, because we just underestimate them that they cannot understand some few things. So give them a detailed explanation on why they should adhere to those preventive measures. For example, excuse me, using mosquito nets. I mean, in my house, we had about 5 that we never use. We're even getting them to dry fish and some other things. That was because they didn't explain to us how much is important for us to use it. We just felt like you give us heat and everything. So you explain to them when you give them those materials how they should use it, the importance of it. You can tell them that when they wake up in the morning, to tie it up before sleeping, put it down, all of those things. And of course, mosquito repellents. Most of them feel like it's wastage of money. Some hear that it's poisonous. You can advise them that once they use it, they can actually step out of the house, spray it in the house, then they enter the house before they sleep, and that will actually help to eradicate those mosquitoes, which is the main cause or the main vector for malaria parasite. So that's it. But I think the main thing is basic education. That's, you give them a detailed explanation of what they need to know, and of course, ensure their treatment. Do a follow up on them. Try to tell them the importance of clearing the bushes around their area, because of course they love gardens. You can tell them to always keep it clean and to monitor and prevent the spread of mosquitoes. And of course, dorms, you can tell them to cover the dorms. It's just for you to educate them properly and do a follow-up on that education. Thank you very much.
Thank you so much, Miss Miranda. And just to say something about that, especially, comprehensive health education is very key, especially when you go to communities. We had a situation where we went to the community, this same issue of mosquito nets. And when we saw a lady, she was using mosquito nets as to cover her vegetables, okay? And when we asked her if she knew what that thing was, she said it's something that helps her to to prevent insects from eating her vegetables. So that's how it's used. She doesn't know that it's used to sleep under to prevent malaria. In other scenarios, we found them using it as a net to catch fish. So when you're going to a community, especially health education, it doesn't limit you to just saying this is how it's done. You have to practice, you have to show physical demonstration. You have to demonstrate how that mosquito net is used. It's very, very important. At least do your part. There are people that will not take you serious, but be rest assured that you have done your own part. Okay, I think I have another contribution here. We will soon be going to the open debate, so please just hang on. From Mr. Oates, he said he would like to add something concerning mental health issues. So Mr. Oates, if you can hear me, maybe you can unmute yourself and quickly give a contribution. Please be brief and straight to the point.
Okay, thank you for allowing me to say what I think. So regarding what they said previously about mental health disorders, I would like to say that all the causes, or yes, all the different causes they cited previously are really effective. But the main problem with the mental disorder is is around the neurotransmitter, the production of neurotransmitter. And it's not only the fact that you smoke or the different reasons they highlight previously. The simple fact that the food we consume also could reduce, okay, the production of those neurotransmitter, or could increase. But what is more important there is like, if we should have like we should adopt, okay, a healthy food habit, because it will lead to the production, it will enhance the production of those neurotransmitter, and it will therefore, if those neurotransmitter are produced in higher quantity, it will reduce, okay, all those depression and other mental illness. This is what I wanted to add.
Okay, another
Globally too.
concept of food technology coming in. I'm very sure by the time we dive into the open debate, which is like 5 minutes from now, we're going to be having such opinions coming in. I'll answer the last question on this session from Mr. Cyril. He says, please, I have a question for Ada. How can an undergraduate student in bioengineering or other fields, especially the ones abroad, volunteer towards community growth? I believe that there are students out there looking for NGOs to volunteering, but distance seems to be an issue. Do you have any recommendations to solve this issue? Of course, I have several recommendations because community health is a passion for me. So I have some pretty straightforward recommendations. When you're out of the country, it's always seems like distance is a barrier. But if you are committed, there are several NGOs you can volunteer in. And when I'm talking about volunteerism from abroad, you have a broader knowledge of how things are done. You have a more enhanced view of how better health should look like, because we kind of believe that those in some developed European countries, they're enjoying better health than those of us in African countries. So you can compare the two contexts, the knowledge you have, how then do you dish it out? You may not be there physically, but you have that knowledge in your head. So connect with any local NGO on board in the country and give them your suggestions. Okay, I always tell people, when you join an NGO is not there for, it's not to develop programs and come and say, okay, this is the program on this date you're joining. No, an NGO simply means it's giving you a platform to execute your ideas. It's a platform for ideas, and ideas matter more. As a wise person once said, ideas are the key. Ideas are the key. So if you have your ideas, look for a target NGO that is interested in what you're maybe interested in, connect with them, share with them your ideas. You can even coordinate a program from abroad. There are so many ways you can coordinate a program without being physically present for that program. So if you have so much community work at heart, just connect with any NGO of your choice. There are so many out there. Connect with them, share with them your ideas, see how your ideas can be implemented at a local level. And I just want to inform you that I have so many people who are abroad that are running NGOs, that are contributing in NGO development, that are contributing community growth via NGO development. There are so many of them who have just made themselves as goodwill ambassadors. They just from time to time they always ask me, Ada, are you having any program? How can we do? What do we do? What do we need to? And all those kinds of things. We've had the free dental campaign we had of recent. We had a friend of mine who donated free toothbrushes, and her NGO's logo was on those toothbrushes because we wanted to make it known that this came from somebody who has a community at heart. So there are so many ways in whatever field. Health is holistic. Health is every field. Health embodies everybody, economists, lawyers, whatever field you find yourself, there is health in that field. So just feel free, reach out to the NGO you want to reach out to, share with them your ideas and see how you can partner with them and push those ideas to become a reality. So, okay, I will be handing over to Mr. Ransom to take over the open debate session. And in this session, just a brief reminder, please don't keep your mouth shut because it's an open debate, meaning everybody's opinion counts. So over to you, Mr. Ransom. I hand over the platform to you completely.
Okay, thank you very much. I think we've had very excellent presentations today, and we've talked about malaria, we've talked about mental health, and I think that we have to observe that even the World Health Organization have given some facts as far as the universal health coverage is concerned. And one of the first facts that I would want to state is that more than half of the world's population still do not have full coverage to essential health services, and more than 930 million people still spend, that is approximately 12% of the population in the world, they still spend more than 10% of their household budgets on healthcare. And we have more than 100 million people who are still being pushed into poverty, that is extreme poverty, living on less than $1.09 or even less on a daily basis because they have to take care of their health. And now the countries, that is all the member states of the United Nations, they have agreed that they want to achieve universal health coverage by 2030 as part of the United Nations Sustainable Development Goals. The question we want to discuss about in our open debate is the active role that we as youths are playing in enabling or in assisting our countries to achieve this universal health coverage by 2030. Before we actually begin, I would like to reemphasize that we should observe order. If you have a question or if you want to make that is a contribution, simply raise your hand and simply try to go straight to the point. We have 1 hour, 30 minutes for this, so we should be organized so that we can actually achieve the objectives that we have. So with that, the floor is open. If you have any contribution as far as youths are concerned, that is in playing an active role in achieving universal health coverage, you can simply raise your hand. I'm waiting for everyone to contribute.
Ransom, I think you can check the chat section. There are some interesting things popping up.
Okay. To begin with what is going on in the chat section, I see, is it Miranda? Miranda has something to say. I don't know if this is related to the open debate, but I would just like to read it. And she's saying that, yes, those in communities can, however, I believe, I behave, okay, I believe, I don't really understand, but they should use what they are affordable with. Okay, she's talking about malaria and things. She's still talking about recommendations on how people can actually be able to not only know that malaria is there, but to actually prevent themselves from malaria, which is very important. Still looking at to see if, okay, I think there is a hand up, and that is, yeah, we have a speaker from Benin. Okay, please, you can unmute yourself and you can speak.
Okay, thank you, Mr. Ransom. First of all, I would like to thank each and everyone who presented something today. I really listened to each presentation with great interest, and I'm quite happy that to see the zeal everyone has towards achieving universal health coverage in Africa. However, I wasn't really satisfied because, since these past years, different trends have come up, and one of them is the rise of the healthcare costs. I don't know if you ever heard about it. And this rise of healthcare costs actually made people, I think that in Africa, we don't really see it that way, but if I have to address it this way in Africa, we can realize that most often the rural communities in Africa don't really have access to healthcare, rather because maybe the healthcare I say the hospital are far, maybe from the center or for other reasons. And if I leave that the rise of the healthcare costs recently realized, we have also the social perception that the food we consume, okay, defines our health. So if we continue that way, you can realize that those two trends, as example, led to a demand for food with some asserted health benefit. You understand me? So meaning that right now people focus more on the consumption on any value added food to address health issues instead of going to hospital. But unfortunately, since the beginning of this webinar, I haven't really heard any presentation with an emphasis of the use of food as a tool to achieve universal health coverage. So my question is, how could food be used to achieve universal health coverage?
Okay, thank you very much. I think that you raised a very important point, and we have health experts in the house. However, we're not able to have as many presentations as possible because we allocated time for this. I don't know who is going to start with answering this question, but everyone can answer. It's not only those who presented, but this is an open question, and everyone has the opportunity to contribute to this.
Okay, I'm listening.
Mr. Ada, do you want to comment on this, or Ms. Adarada?
It's a really sensitive topic because I think we really did not include the aspect of food rather, and like it is popularly said, you are what you eat actually. So if we're talking about universal health coverage, which is health for all, I'm meant to believe that if we can adjust our dietary components, if we can adjust the way we eat, it will boost up our immune system to be able to naturally fight certain diseases on their own without necessarily consuming drugs or without taking some of those drugs. And the good thing about Africa in particular is that we have much of the natural food. We have much of the natural herbs and natural food. We don't have so much processed food in most African countries, which is an added benefit if we should maintain or we should follow strictly that kind of dietary composition. So yes, food has a lot to do with achieving universal health coverage, a lot to do with achieving universal health coverage. Because if we are trying to look for a way where everybody, when I mean everybody can access quality healthcare, it doesn't necessarily mean going to the hospital to be able to achieve that kind of improved health system. If you can sit at home and improve your own kind of food that you eat and boost up your own immune system, then it's going to be achieving universal health coverage for all of us. And also, one important thing that it was said was there is a question that is in the air right now. COVID-19 came, it hit Africa, true, but there is a question of why are there lesser mortality cases in Africa? Why are less people in Africa dying? even though Africa was hit by COVID-19, even though they said Africa had a fragile health system, Africa had the weakest health system, but we are recording lesser numbers of mortality cases. And somebody correctly said in one of his articles that maybe it's because of the food we eat. In Africa, we consume natural foods a lot, not processed food. So maybe it has given us an extra boost. It has given our immune system an extra boost to be able to naturally fight COVID so that the mortality cases are less in Africa. So it brings us back to the same thing. Food is a key in achieving universal health coverage. So that is my own knowledge about food, though. I don't know much about the science of it.
We have two other hands up, and I think we're going to begin with that is Mafo from Cameroon, please. Can you unmute yourself?
Yes, according to, I just want to add to what Cynthia said, because she just elaborated on my idea, and said to add the economic aspect of the food. Like economically, if we produce more food, we can sell more food, and that is boosting our economy. And then we see how we can have finances to finance our healthcare. That is just a point I wanted to add to what Cynthia said when it comes to food.
Okay, thank you very much for your contribution. We also have, that is Ngo from Cameroon. You can unmute yourself, please. Okay.
All right. Thank you, everyone. Thank you for the presentation that was done before. I had some problems with connection and power. Yeah, but concerning food, when you talk of food, it goes back to agriculture. And Africa, we are blessed and endowed. Africa has 60% of the world's arable land, and which shows the potential that Africa has. But it is very unfortunate that most of the aid in the world is coming from other countries that they don't instead have arable land. This is, I think, for us to attain a universal health coverage, which Africa should first of all believe in their own method. We should try to develop Africa by Africans' way, in the Africans' way. Africa should develop by method of its own. And agriculture, I think, is a very good platform. Because one great man, I think, let me call his name, Dangote of Nigeria, he was asked, what is the future? He said the future is agriculture and ICT. Yeah, because people will eat until the world ends. That is, I think that is a good ground that Africa can pick from and attain universal health coverage. Because before, we used to think diseases like cancer, high blood hypertension were mostly diseases from the West before. And now it is gradually entering our own society because we have changed lifestyles. We think that maybe in taking lifestyles from the West, the way they behave, the way they eat, you see, is gradually bringing in some of those diseases that were not common in African setting. So I think even we improve our food and our diet is going to help to improve our immunity and also make us strong. And health is a precondition now for development. Health now is no more a byproduct of development. It is a precondition. And for us to for us to attain that level, we need to be healthy by eating good food, as it is said, we are what we eat. Thank you.
Thank you very much. Your contribution is quite good. We're going to move to Eno Bless, who also has a contribution to make. I think, Bless, you can unmute yourself.
Okay, thank you. Thank you very much once more for giving me the floor to talk. With respect to our discussion topic, I think youths have a lot to play when it comes to not just universal health coverage, but a lot of things when it comes to nation building and progress or development. Especially in the context of this webinar, we've had youths, or let me say all of us are youths that have a certain academic background, or we are involved in research one way or the other towards achieving a universal health coverage. And just to begin with the question, the first person, somebody asked a question on how it affects the economy. There's a concept in health. I don't know if it's public health or it's just everywhere, but they call it DALYS, DALYS. I can't really remember what it means. It's been long I used it, but it's a system in which you calculate. For example, let me illustrate a story. A child who is supposed to go to school doesn't go to school because, say the child got cholera. Now that child did not go to school for 2 days because he got cholera, the child is at home. That child sleeps on the bed in the hospital, occupies space on the hospital, which is government money. That child takes drugs that was supposed to be used for, maybe for in more serious cases. That child is absent in school and doesn't use certain government resources that have been put in place to educate them. That child has missed a certain lesson that could have helped him, or that child didn't is using some of the money their parents is supposed to use to make food in the house and all that. So there are certain ways in which you calculate that, and when you convert all those losses, all the morbidity, you convert it to money, it translates to millions of dollars at the level of the country when you do that for everybody. So the country loses millions because of that when you do that at a larger scale. So to come back to what we as youths can do to achieve this, we as researchers, we have to be conscious of the fact that the information that we get is information that can be used to better the lives of others. And unfortunately in Cameroon, we have this issue where you don't really look at the role that postgraduates can play in informing policies, for example, because I am from there, so I know how the library in UB looks like, very big with abandoned theses there that is being covered by dust, and a lot of those theses are not published. And when they are not published, almost everybody forgets what's been done. And one of the reasons too is that the work the most of the works that are carried out are not statistically sound, or cannot be defended at an international scale. You can't really use it to inform policies because the methods are a bit weak. So also we as a user should be conscious of the fact that we need to know the right methods to use for our work, and we need to know the policies that are available, or the kind of policy, the kind of improvement we can make to the system. We need to involve ourselves more in those talks. If you don't, you'll be doing research that cannot lead to any innovation, cannot solve any problem, cannot help anyone in society, and of course, nobody even ends up seeing what you're doing. So we should know the right methods, we should know the right ways, and the robust methods to use in our work to profit from our data at a at a maximal level, so that we can contribute it with our research. And we already talked about volunteerism, and we should also be context aware of our. We can't. I think something like witchcraft, which has been mentioned there, we shouldn't. We as scientists, yes, it's witchcraft. It's science. It's just that a lot of science can't really prove what's going on, but it doesn't mean it doesn't exist. It does exist. Science proves a lot of stuff, but witchcraft, I think one of those things but there's something like metaphysics that explains some of these things. Now, we can't just go to a community and say, oh, this is not witchcraft, this is not witchcraft, or this is science, we can't prove it. No, we have to come up with innovative ways in which we can approach the communities and school them on some of these things that these changes that we want to see in the community, in order to have a sustainable change, because they will tell their children tomorrow and their children will tell their children. So if we can't come up with innovative and sustainable ways, then it's going to be a problem for us. Thank you.
Okay, thank you very much. I just want to say again that the topic for debate is we are looking at the active role that youths are playing in achieving universal health coverage. Please, if you've raised your hand, keep your hand raised. You're going to have the opportunity to talk. Everyone is going to talk. And those who had questions, like those who had questions in the chat section regarding some of the presentations that we had, you can also ask the questions now, and the floor will be given to the presenters to answer your questions. So I'm going to the next. That is the next person we have here. That is I don't know, Ileri from Nigeria. If I'm pronouncing the name well, I don't know.
Oh yeah, it's Ileri from Nigeria.
Okay, super. It's your turn.
Okay, so I just want to add to what you guys have talked about today. You guys mentioned about the government, the NGO, the roles and their roles in the community health, right? But like what I have always thought about is that we don't have to talk about the community, the rural areas only. Okay, there are places that even developed in Africa, but people are ignorant. People don't have the knowledge on how to take care of their health. We as the youth, we have more access to social media, right? We know how it is going in the world. We just don't use our social media to just take pictures and post and all that. We can use this to educate people. We can use this to educate people on their health, on how to take care of their health. When you're sick, you go to the hospital, because I've seen so many people, when they are sick, they just stay at home and take some, they don't go to the hospital. So I think we can educate people in the community, not only people in the rural community, even people in the town, people that are even educated, they went to school, but they don't know the right thing to do. So we can try to educate them, to make them know what they're supposed to do whenever they are sick. This can also help them. And someone mentioned about food. Yeah, food is very important, because most diseases, most diseases are due to lifestyle changes, right? Maybe diabetes, hypertension, they might be due to genetics, and also food also has a lot to do with them. So when we go to the hospitals, I want to tell people, especially those in the health sectors, that when patients come to you for diabetes, hypertension, you just don't prescribe drugs to them. Because last year I did my observationship in Nigeria, and I realized that when patients come with these diseases, doctors forget to mention to them about their lifestyle changes, which is very important. If you are diabetic, you should know what food to eat. If you're hypertensive, you should know what food to eat. You just don't take medicine and think you'll be okay. You have to correct your lifestyle. I think that's all I have to say. I just want to to summarize it. We need to educate people.
Thank you. I think that is a marvelous contribution. So I think this is part of the education that we're already doing, and we have to continue in this light, because it's kind of what we call health activism. So we have to continue in this light to make sure that we do not only use the social media that we have before us, actually a very good tool, maybe for social life, but we use to educate people when it comes to health. Please, everyone who has raised their hand, keep your hand up. Let me go to the chat section for a moment. We have a question from Asonga Fak, and I want to read the question so that we don't miss it in the course of the debate. So he's talking about, let me just read it as it is. Talking about mental health care coming from Cameroon, I believe there is a problem related to kids' mentality, as many children are emotionally neglected and their parents are not aware that they are impacting in their children traumatic experiences, making them to feel as such. So how can an NGO target such cases, because there is no treatment to what they don't know? Thank you. I think this is a question directed to the presenters, and I would like to give the floor to Jamin, because he's the one who did the presentation on mental health, to throw more light on this. Jamin, are you there? Okay, if he's not available, not to waste time, please. Any other person who has an answer to this question can take the floor, please. Okay, if please, you can be thinking about answers to this question, then we're going to move to the next person.
Ransom.
Yes.
Okay, so just so we don't waste so much time, the person is talking about mental health and kids, right?
Exactly.
Okay, children are sometimes, there's a saying that children are a product of what they see. Children are a product of their environment. Children are a product of what they hear. So there are so many things that NGOs can do. And I think this is also an important question because NGOs have kind of neglected this area, especially when it concerns kids and mental health, because a lot of them watch so many shows on television. There are a lot of video games out there that promotes gun violence. So all those things affect their mental. And there's also a saying that children have emotions. The way you raise your child, they have emotions. If you yell at them too much, you teach them that this is a certain manner in which they should behave, you're indirectly impacting on their mental health without you realizing it. Especially in Africa, where we so much believe in corporal discipline, all these kinds of methods, it impacts on the child's mental health. So the first thing I can tell you as an individual is you have to watch what your parents, what kids watch. You have to monitor what they watch. With these days, you find kids who are so young and they have phones, they have tablets. You have no idea on which site they are logging into. You have no idea about the peer pressure also exists among kids. Where you go, maybe you find a child of 12 years, his fellow 12-year-old kid has a phone, and it begins to play on his mentality, like maybe my parents don't love me, my parents are not taking care of me because A has this and I don't have this. So it's centered a lot around parental care, like Ransom has just stated, parental upbringing. You have to monitor those kids. You have to monitor what they watch, what the phones they have, what do they have on those phones? What do they watch on those phones? What do they spend their time doing? Who are they texting? Who are they listening to? You as the parent, how do you behave in front of your kids? You as a sibling to a kid, how do you behave in front of your kid? Do you help your siblings or do you just expose them to just whatever? Mental health is very key because as a child, the child's brain is still very, I like to use the word fresh and fertile. So whatever you deposit there grows very well. If you deposit hatred, it goes very well. If you deposit love, it goes very well. And there are so many programs, I think, that if you go to YouTube, there are so many helpful kids program that enables them, that helps them to learn. So in as much as the internet has a diverse range of things, there are so many helpful things on the internet too. So thank you for creating our awareness. I hope one of us here at the end of the day will be starting an NGO that is specified for kids with mental disabilities, because in the US and other developed countries, they are more developed since most of them are suffering, most kids are suffering from such issues. So they have taken into consideration mental homes for kids and all those things. But in Africa, I don't want to say they don't exist, but I believe that most of us are not quick to identify them as a mental disorder when it comes to the child. So it's an eye opener. It's a call for reawakening, and we're hoping that one of us in here can take up the call after this and start something great and amazing. So
okay. Thank you very much. So we have to focus on parental care. We have to focus on a good upbringing for our children to make sure that, because this is also going to influence their health in the future, especially in terms of mental health. We have, I think the next person that I'm going to give the floor to is Landry. Landry, are you there?
Yeah, Mr. Awesome, thank you for calling me. I wanted to answer a question concerning the debate we opened. What I will say quickly is that everyone here is involved in different fields, so everyone should think about what he can do according to his field. For example, I think that people already emphasized what I wanted to say by the fact that first people need to be re-educated. You understand me? For example, in Africa, we have many food, but people don't really know how they could miss the food. People don't really know how they could eat this and eat this, because of course it's good to eat food, but the truth also is that we have also that the concept of nutrigenomic, like what food says to our genes. You understand me? Meaning that we cannot really miss any kind of food that way. So people need to be re-educated about how they can eat, about how they can consume food. And actually, this is what we can use. We can use our different social media platform to, to get to more people. And why not, if we are in touch with some NGOs head, we can still find a way of how to maybe direct a program, in collaboration with them, how people can, where we can teach people how they can take good care of themselves and through food. This is all what I wanted to add. Thank you.
Okay, thank you very much. I think you've also raised a very good point, because if you look at it from a micro perspective, you realize that we are all members of different families, and we are part of the process to making this happen. So it begins with us. We have to start by educating ourselves, educating our families. Then from there, we start educating our extended families. We go to communities, and that is how we educate everyone. So it is more or less something that if we must achieve it, then we must start from the individual level, then we go up to the collective level. The next person, I think we have Leslie from Cameroon. Please, you can go on. Leslie, are you there? Okay, if Leslie is not there, then I'm going to go back to the.
Can you get me now?
Yeah, okay, thank you.
Okay, can you get me?
Yes.
Okay, I'm Leslie from Cameroon, and I'm actually very privileged to be part of this very empowering session talking about USC. And I just want to go to the debate topic and raise my own concern as concern young people. And I want to say that, as we all know, the African population, especially in sub-Saharan Africa, is almost 60% made of young people, and that's a great human resource as concerns USC. And what I want to actually lay emphasis on is the fact that if we are talking about UHC, that's universal health coverage, and we are not talking about the issue of accessibility and affordability, then we are actually missing a cause. Yes. And when we're talking about making healthcare publicly available to everybody, we are talking about making it accessible and affordable. How do we make sure that people in local communities are having access to healthcare, quality healthcare? How do we make sure that a mother who is in a local village somewhere in Cameroon can have access to health care facilities that are popularly in the urban area? And I want to say that young people in Africa have been trying to come up with very innovative solutions to make sure that they reach out to local communities and provide them access to healthcare, especially in this advent of using technology. I think they have used what we call digital healthcare to make sure that they leverage digital healthcare and provide access to quality healthcare to people in local communities. And in Cameroon here, when I want to talk, I will give an example of an innovation like the cardiopath that was designed by a young Cameroonian here that helps in carrying out cardiovascular tests in local communities and sending the results to a hospital in an urban center so that it can be analyzed, and then somebody is diagnosed with a particular disease. And there are other young people around who are also designing innovative solutions in that direction. So I would say that yes, there is no way that USC will be achieved if young people are not fully integrated. And as as we were discussing earlier, talking about volunteerism, yeah, volunteerism is a full part of it. But also, I want to insist on the fact that young people in Africa are using what we call innovative solutions to actually make sure that healthcare is accessible to people. You know, they have always called us the Android generation, and we are using it positively in that direction. So they are making healthcare accessible to people in local communities and affordable to them using innovative solutions like the cardiopod that I just mentioned. And if you go to countries like Kenya, you go to countries like Rwanda, go to countries like Nigeria, especially, they are very innovative in this direction of leveraging innovations, technology to make sure that uh, healthcare is accessible to people in local communities. So I would say that yes, young people have a big role to play, and they're actively playing that role. When we talk about integrated health organization, we're talking about a group of young people who have decided to take community health in their hands to make sure that they help young communities grow, have access to healthcare, and and they do this using innovative solutions, using the social media, using community outreach, and going down to communities to make sure that they preach preventive healthcare. And if we can put those efforts together and reach out and talk about Africa, the impact they're creating in Africa, we see that young people are not only talking, so they're actively involved in the issues of providing access to healthcare to local communities and in urban areas.
Okay.
So yes, for me, it's a yes. Young people are doing a lot in providing access to healthcare, not just a lot, but also innovatively in Africa. Thank you very much.
Okay, thank you very much. We have a good number of hands up, but before we go to the next person, I would just like to say that please keep your answer short or keep your contribution short. If it is a question, just go straight to the point so that at least everyone should have the opportunity to say something. So I'm going to go to the next person, who is Tanya from Cameroon. I don't know who is from. Tanya, you can unmute yourself, please. Are you there? Okay, if he's...
I'm there. Are you getting me?
Yes, I can.
Yes, I'm there. Are you getting me?
Yes, I can.
Hello?
Go on.
Can you get me?
Yes, I can get you. You can go on, please.
Okay. Thank you very much for this wonderful opportunity. Tanya joining you from South Africa. Actually, I want to thank the host for such a wonderful initiative. First, we are talking about universal healthcare. And when we talk about universal healthcare, we are talking about the fact that all individuals and community receive healthcare service they need without suffering financial hardship. Yeah, so that is what we are talking about, how each and every individual can receive health service without suffering a financial hardship. And when we talk about the role of youth, as far as universal healthcare is concerned, I can say the youth are actually playing their part in achieving universal healthcare. And if you look like the activities going on now, and some of the NGOs that are in Africa, you see that 80% are made up of youth. And when we talk of universal healthcare, we talk of health promotion to prevention, treatment, rehabilitation, and palliative care. And youth are playing a lot of role in promoting health. Obviously, actually, if you look at some of health organizations and NGOs and so on, you see that the youth are the one taking the risks and taking the courage to go into the interior, yeah, to assess the communities to make sure that they really receive health care. Yeah, and they are doing that in the form of NGOs, not even through government organization. Yeah, and when we also talk of universal health care, the government also have a role to play, because we are talking of each and everyone receiving health care. So the government has a major role to play in this as compared to the youth even. Yeah, but I can say Africa got a long way to go in achieving universal health care, because the government is like, the contribution of the government towards this is not up to 50%. I can say, for instance, in Cameroon, I belongs to one NGO, they call Doctors Without Borders. Yeah, that are working closely. Hello?
Yes, try to keep your answer short so that others can also have the opportunity to...
Okay. I was saying that like in Cameroon, I belongs to one NGO, the Doctors Without Borders, and we have been working so hard in achieving universal care, especially during this crisis period, helping even those with mental health and so on. So just of recent, you see the government came with a communique to show that the activities of Doctors Without Borders has been suspended till further notice that they need to like identify their action. But that is an organization that has been working so hard to make sure each and everyone receive healthcare despite the crisis with little or no income being paid. So you see, the government is like, if we are talking of achieving universal healthcare, in respect to the youth are playing their part, but in respect to the government need to come in play. If the government can't come into play, then we have a long way to go in order to achieve universal healthcare. Yeah. And I heard some of the presenter presenting, like Ms. Daga Miranda, like she made mention of the fact that there are no road, little or no road to access rural areas, and those are the people that really need healthcare. They are little or no road, and that is where the government have to come in play. And those people, even they have little or no health center, not to talk of drugs, not to talk of even first aid drugs. So the government really have more role to play in respect to universal health care than the youth. And the youth are actually playing their role. Thank you very much.
Okay, thank you very much for your contributions. Please keep your answer short to everyone who is going to have the opportunity next to speak. Then I also want to say that in as much as we have so many examples from Cameroon, we should understand that it is not all about Cameroon, it's about Africa. And I believe that Cameroon share a lot of similarities with other African countries. So whatever is happening in Cameroon in terms of universal health coverage is equally or can also be adapted to the other local realities that we have in other African countries. So I'm going to go to Cyril from Cameroon. Cyril, it's your turn. You can go on, please. Okay, if Cyril is not there, then I'm going to go to that is Cyril, are you there?
Can you hear me clearly?
Yes, I can hear you. You can go on, please.
Okay, thank you very much. Actually, my mic was disturbing earlier. Okay, thank you all for your brilliant presentations. My name is Cyril, I'm from Cameroon, but currently I reside in Istanbul. I'm a student of bioengineering. I would like to make mention of a current challenge that is preventing universal health coverage in Africa, and it's about vaccines. One of the major challenge in Africa is that there is current continuous outbreak of epidemics, diseases that come, spread and infect a lot of people and then they disappear. And a way to counter epidemics is by administration of vaccines. So a vaccine is meant to boost your immune system so that when an epidemic arises, your immune system is going to be able to fight the disease. But in Africa, or in other places of the world, there are conspiracies going about saying that vaccines are bad. And unfortunately, many people believe these conspiracies. So when the time comes to take vaccines, when the time comes for administration of vaccines, many people refuse. They don't want to take those vaccines because they believe vaccines are bad. And others believe that a vaccine is a virus that is meant to infect them or kill them. And it's true, a vaccine can be a virus, but it's not meant to infect you. But because many people believe otherwise, they don't take those vaccines. So my question is, what measures can we take to convince these people that vaccines are not meant to kill them, but to help them not to get infected by some epidemics? Thank you.
Okay, thank you very much. That is a very good question. I'm going to add this other question so that the answers can all come in a block. So there is this other important question from that is Usmanu, and the question has to do with African traditional systems. He has this to say: how can African traditional systems, such as the use of herbs and other ancient medicine, be optimized to improve our health system? I think this is also a very important question. Please, I want to beg on you all that if you want to give an answer, maximum is a minute so that we can be able to finish everything in time. Thank you.
Okay, can I answer this question?
Yes, you have to.
To the African traditional system, what I can say quickly is that first we need to characterize these herbs. You understand me? Because most often we can find one herbs in Africa and they say that it traits, I don't know, 5, 10, or 7, more than 7 days. It's not possible. We need to know to characterize these herbs first, okay? And after we need to do an optimization of the extraction process, okay? Because generally in Africa, we extract all those bioactive compound hot, because generally there is two way of extraction, the hot way and the cold way. But the problem is that the hot way generally, okay, what we call infusion, you put it in hot water and whatever it is, leads more often to the development of all those advanced glycation end product that are also really dangerous and really difficult for our system. So what we have now to do is we have to find, okay, the right way to extract the molecule, the enzyme, or a bioactive compound, okay? And then why not? We can use an encapsulation method, okay? Maybe using stack to encapsulate them so that people can consume it. But now this is already a little bit sophisticated. I think that we need to work on right now is to find the right dosage. You understand me? For example, people are used to maybe drink 1 cup morning and evening, and they drink it maybe for 5 days. Okay, we need to know the quantity after how many days the person is able to be okay, to heal. We need to know the dosage because this is the most problem we have. Because sometimes, and also I think that we need to carry out more research to assess the effect of the long consumption of all those herbs on our health. This is also really important because I think that in Africa, we don't really focus on all those things. They are really important. A long consumption, a long time, long period consumption of this consumption, like this infusion, what is the effect on our health, especially our kidney? Because, you know, all those herbs have a higher content of all those heavy metals and all those toxic compound. That's not really okay for our health. So to resume myself, we need to think about how to change the hot optimization. Okay, even if you have to do an hot optimization, maybe the temperature shouldn't cross the 70 degree because that is really important to extract. Or what we can do also is that after boiling, maybe the water, okay, we take the water down, we let the water cool down till 80 degree, and we now we then put the herbs on it. But like I said, the most important thing is to really make it functional is we need to know the dosage. I mean, what quantity people can eat. This will really improve and we make a good optimization, okay? And we need also to think about the effect of the long consumption of this extract on our health. Thank you, Mr. Evans.
Thank you very much. You raised very important issues here. Believing that all of us here are in one way or the other students and practitioners. I believe that this is something that we should be into because we are not only here to talk and go back home, but we're here to talk and practice what we're talking about. That is one thing that we should keep in mind while in this webinar. So I'm going to, Ms. Ada, do you have any other thing to add to this?
Yeah, just about the question Siri asked.
Why? I'm going to come to you just a minute, please. Okay.
The question Cyril asked about how do we convince people about the benefits or the good points about vaccine. I think the last time we had the webinar, this came up, and I'm very happy it's coming up again because there are a lot of theories or whatever surrounding vaccines. Now, I will just tell you one thing. In everything, there are always rumors. In everything, there are always conspiracy theories. Vaccines are generally meant to protect us if they follow all the procedures, phase 1, phase 2, phase 3, tested and proved that it's actually safe for human consumption. Now, in as much as people will do their best to spread what they believe is false, when vaccines come out, it's for our own benefit. So are you going to be the question you should be asking yourself, Are you going to be one of those who will join social media in spreading the false rumors? Or are you going to be one of those that will actually help people to know that vaccines are actually for their benefits after having done your own research and have the points that you want, like you're able to talk with concrete point that this vaccine is good. So there's always going to be that kind of theory, but trust me, when vaccines are tested and proven, the world is in a better place today because of vaccines. Polio is gone, so many diseases have been eradicated thanks to vaccines. So before you join the media is a very big tool. I cannot overemphasize how media has changed the way we see the world today, but vaccines are good if tested and proven scientifically. So I don't think there should be any problem in consuming a tested and safe vaccine. That's just all I have to say. Just do your research, get the facts from the right source, and know what to do. Thank you.
Okay, thank you very much, Ada. I'm going to give one last opportunity to, that is Tanyi. Tanyi from South Africa. Okay, you can go on, please.
Yeah, thank you very much for this another opportunity. Firstly, I would just want to throw just one word in respect to the vaccine. Actually, there are two goals for vaccine: effective and safety. They work, they are mutually related. For a good vaccine must be effective and it must be safe. If a vaccine is effective and it is not safe, then it's not a good vaccine. And likewise, if it is safe and it's not effective, it's not a good vaccine. So if you see like some people are all advocating, they are not advocating as if they don't want vaccine. They are advocating for a safe vaccine, because we all know vaccine, they got a very good vital role to play in respect to our immunity. So it's good that we have like what Ms. Ada just said, we should do our own research. It's very important to do research. And there are some criteria of people that require vaccine, while there are some others that don't require vaccine, like especially those who are really immunocompromised. They have their own level of treatment that they require. So you should do research, find your place, find your position, where you belong, and know what is necessary for you. And the part I also like is vaccine should be voluntary. So if it's voluntary, like you enable you to choose what you want. Because we are all talking about the safety of a vaccine. Thank you very much.
Okay, thank you very much. So vaccines are very important and they are supposed to be safe and effective. So we should do our research and make sure that if vaccines are for our own benefit, then we should take them. So we have some contributions in the chat section. The first contribution is from Jamin, and he's talking about the role of young people in achieving universal health coverage. And he's saying that the role is very important. And he's talking about the example of this webinar, where he says that the average age, that is approximately, that we have here should be 26, which clearly shows that a cohort of young people interested in universal health coverage can be very important in achieving the objectives of this program. So we are a huge resource in actually helping to achieve universal health coverage in Africa. Then the other contribution is from Leslie, and he's talking about universal health coverage basically being in the hands of the young people. So young people are not only carrying out interventions, but they are also advocating for improvement of healthcare policies. So these are very important points that we should note. And I think that should be all for the open debate. We're now going to go to
Ransom, before we conclude, I don't know if I can add something with the question on traditional medicine. My connection is quite disturbing, and I happen to lose all the chats. So I don't know. I cannot really recall what his question was all about. But I just want
traditional health systems.
Yes.
Okay. The question was about that is the importance, the use of traditional health systems like herbs in actually promoting healthcare in Africa, because maybe what I understood is that maybe we have overemphasized the drugs and all that, forgetting that we also have things like herbs that can actually help in improving health. So what is the importance of the traditional health system in helping to improve health in Africa?
Okay. All right. Thank you so much. I think it's a very good question, and especially in our African setting. I don't know if you can get me.
Yes, we are getting you. You can go on, please.
All right. I think there are so many advantages. I can just name some few, like for presently with the advent of this COVID-19 here in Cameroon, there have been so many traditional jobs that came up, and let me not lie, some of them are like I cannot judge, I cannot really like give a definite answer, but I can give my point of view. There are some traditional herbs that really help for this. When you have when you have a flu, I don't know if it treats COVID-19, but when you have a flu, I know you can eat ginger, you can boil it with limes and some kind of mixture, and it works. It works for me. So for me, traditional medicine is really important. Because it's quite accessible, it's affordable, and it's more like directed to a particular culture. It's more of if here in Cameroon, we can easily use this traditional medicine to cure certain a targeted disease, but maybe for someone out or someone abroad, it might be a little bit complicated. It might not work for the person. So traditional medicine can work in that way. But my only concern with African all the how can I say the dosage. We don't know how the prescription, it does not have a fixed prescription on how to consume the drugs. And then the second problem is also the hygienic method in which we even do this we even produce these drugs. Do we actually respect all the hygienic methods? Do we have like a correct diagnosis on the drugs we are taking? There's this lack of complete code of conduct in taking out in consuming this traditional medicine, even though they might be good for certain people, for some people. But we need to take into to consideration all this. There is also a lot of, how can I say, there's inefficient control in the market because the it came up the traditional, how can I say, the mixture of drugs.
Hello. Please just summarize everything in 1 minute, please.
To get it short, for me, African tradition is quite good, and a lot of we need to put in more effort in order to be more impactful. Like we need to go in for increase the training. Those who are already into this setting, they can train the local practitioner how to make these drugs. These drugs were consumed in the local were to make it more. I'm really in pressure now, and I'm trying to.
Okay, thank you. Thank you very much for your contribution. I think we've had an excellent debate, and just to add up to what that is saying of the boundary happening in traditional African medicine, and that these African herbs do not work. The problem is that we have not actually done enough research into this to be able to know what quantity that we can actually take when we have them, or even how to process it and who to administer. So this is a big challenge to us who are here today to take this up as some kind of research. I believe that we have a lot of people here who have the research potential to do this. So this was an excellent debate, and I'm hoping that we take home this knowledge and we don't sleep on the knowledge, but we try to put it into practice. I'm going to hand over to Ada, who is going to take us to the networking part of the seminar, the webinar or the seminars. Yeah.
Okay, thank you so much, Mr. Ransom. Thank you for moderating this open debate. It's been an amazing session with all the participants in here. A heartfelt thank you to all of you for sticking out with us up till now. And this is the most interesting part of this session for me. It's about networking. So we're going to have a 10 minutes breakout sessions where I think we're going to be randomly assigned to breakout rooms. So whoever you find yourself with in that breakout room, try to network with as much as possible. Find out what the person does in life, what the person is researching, if the person is a student, if the person has an organization that you might want to follow. Just be as interactive as you can, because after the breakout room sessions, which is after 10 minutes, we're going to be having the final closing remarks, final conclusions from some selected participants amongst us. So once more, thank you very much for taking out your time to inaugurate this International Universal Health Coverage Day 2020. So I'm going to randomly create the breakout rooms now. Wherever you find yourself with, okay, we are 35 of us, so let's say I create 5 breakout rooms. I'm not a good math student. Okay. Okay, so I think all of us have received an invite to join a particular room, have we? Yes, I'm here. Yes, we're here. Let me check. Yes, in my group. They're talking now. Check. And it shows that you're live. Yes, Leslie, I'm the person. Profiles like maybe just about yourself, what you do, if you want to maybe broaden your network, you never can tell who will be interested in joining your programs and things like that. Great, great. It's a pleasure knowing all of you here. It's really an amazing time to spend with those of you here. I'm Adanze and I'm a public health practitioner. I'm a community worker. And I'm also present in Turkey. Yes. Jamin, yes. Who had a question? Somebody wanted to say something. Anyway, as I was saying, I'm doing my public PhD in public health presently. And like I said, I'm very much interested in networking with anybody in present, especially with the people in the Gambia. I'm really curious as to know how the health system there functions. I'm really, really very curious to know how it works out there. So I'm also going to leave my my LinkedIn handle, or preferably my email. You could always reach out to me so that we could talk about lots of things, especially those in the Gambia. I want to know how the health system works there. It would be a great partnership, especially as I run an organization called the Integrated Health Organization. Yeah. Yes, Tanya, we can hear you. Okay, thanks everybody. I think we'll be closing the session in less than 1 minute. Thanks for the networking session. You're doing an amazing job with the antibodies. It's a great research. I've dropped my email in the chat section. You can feel free to reach out to me anytime for possible collaboration. Thank you so much. Yeah, hello. Sorry? A what? Huh. Okay. It's okay. I think we are basically done. So we are going to go back to the main session right now. So okay, are we all here?
Yes, we're around.
Yes, Cynthia. Yes,
Okay. So
Even though
thanks
you
so
cut us
much
short.
for those that participated in the breakout session. I will choose 5 random people to tell me about the people in their groups. Let's see who you got. Okay, let's start with let me see, who do I pick? Okay, Miss Kiara.
Yeah, hello, can you get me?
Yes, we can hear you.
All right. Okay, my breakout session consisted of 5 members, 6 including me. We had Mr. Joseph Samba, who is a um, who recently got his PhD in engineering. I didn't get the first part. Geological engineering, sorry. Yeah. And he's practicing the consultant in Ankara currently. We also had Enu Blaze, who is a biotechnology PhD student in Turkey too. We also had Usmanu Malikli, who is a political science student also in Turkey. And we also had Cynthia from the University of Boya. We also had Yasmin from Nigeria, who is also a public health student in ISM. Yeah. So it was a great breakout session. We had a discussion on the main topics of today and how universal health coverage is actually not, we are not all public health practitioners, but it actually involves all of us Africans. It involves all of us in whatever field we are in. And it was short, but I think we got to know each other. And in relation to the general webinar of today, I think it was a great session. I really learned a lot. And to see that African youths are really engaging and becoming so interested in developing our own continent on our own, it's a great thing to see. Yeah, that's all from me.
Yeah, Miss Kiara, can I just jump in? I'm not a graduate yet from a doctorate degree. I'm a doctorate student. I'm seeing the problem.
I'm sorry. Okay,
Okay.
maybe I didn't get you. I'm sorry.
Thank you so much. I'm going to now talk about Nelson. Are you in the house? Is Nelson here?
Yeah,
Great.
hello to everyone.
Hello.
I don't know if you're getting me. Yeah, hello,
Yes,
are you getting
can
me?
hear you.
Yeah, we can get you.
Yeah, it has been really a very interesting experience for me. I've been really out of my field, but I saw the interconnection between my field, agricultural economics, and public health. And I think like next when I have a field experience, I think I really have an opportunity to see how I can connect myself to public health, like while doing agricultural economics. Thanks. And in my group, we were four of us. Uh, I myself, there was Miafo, there was Fatu, and there was Uit. So I think we should be organizing such a sessions maybe frequently as possible, because it is really it has been a brainstorming experience for someone like me. Thank you very much.
Thank you so much, Mr. Nelson. I'll quickly jump over to Mr. Ngu Clinton. Mr. Ngu Clinton, can you hear me?
Can you hear me?
Yes, we can hear you 5 on 5.
Thank you, Ms. Adenze, for the opportunity. Before the session started, my phone went off. I had to reboot and it came back, but I still joined the session, though it was short. But we tried to keep contacts. We had to exchange emails so that even after this, we could still be communicating through mails. And the groups were, we had Nelson, Fatu, Desmond. I've never met them, but I know through this forum, we are going to meet and discuss ideas. Thank God we are from different backgrounds, but I think all of us have in mind a specific goal, which is universal health coverage. And one thing that I want to also say is that we should believe it's possible. We should always have this belief that is possible. And we also, like I said before, we should believe in methods of Africa. Africa's method. Because we should always try to always bring, while some of these things, the disadvantage receiving end, they are not included in the decision making. They just sit in their homes and NGOs are just flogging in, telling them not to do this, telling them, but people from that community themselves did not give their consent. So I think it should be inclusive. Once again, thank you everyone.
Thank you
Thank you
very
for
much,
having me.
Mr. Clinton. I'll dive to, do I choose? Jamin, can you hear me?
Okay, let me just.
Yes, I can. Yes, I can. I can hear you. Yeah, I am very happy to have attended this webinar in my breakout session, where actually 4 of us. There were 2 of the participants that I know so well, Mr. Leslie and Danze. So we also had Ibrima from Turkey, who is from Gambia, and I got to also connect with him, someone I've never met before. And I think that even after this webinar, we are going to continue communicating. Again, we also had Mr. Tanyi. I was really pleased to meet him, and we had some time to interact. And I think that even after this, universal health coverage is our goal, and we can see how we can keep on implementing even from our tight angles. We know that our little efforts will not be in vain. Thank you.
Thank you so much. 9 minutes to the end of the program, and we'll be rounding off with Miss Angela. Angela TR, can you tell us about your breakout room and your concluding remarks? Miss Angela, don't know if it's Miss or Mrs.
Hello.
Hello.
It's Miss.
Okay.
I want to thank everyone for the wonderful program today, and it was very great. Before coming, I had a lot of questions on my mind regarding universal health coverage, which were answered within the scope of the program. And also the breakout session was really amazing. And I just threw out a question to them, to my group members, like, as a mining engineer, how can I contribute to the universal health coverage? And I got a very good contribution regarding the waste from mines. And I think I'll go home with that very happy, knowing I can contribute. And I was also assured that I can volunteer without any knowledge on health in organizations, because I had some fears like, do I need some degree of maybe health knowledge or medicine or the like? They said no. And I think with this mindset, I can go out to the world and help in one way or the other. I think the session was really great, and Manuela was one of my group members. I'm sorry I could not record the names of the others, but we had a lot to talk about, and I think that's it. Yeah.
Thank you very much. Thank you everybody for coming. And I will just hand over the floor to both Manuela and Ransom to give us the closing remarks for the day, and that will be it. Please do not forget to fill out the form so that your attestations can be emailed to you as soon as possible. So Manuela and Ransom, over to you to give the concluding remarks. Thank you. Manuela or Ransom, or Manuela and Ransom.
Okay, let me begin. First of all, I want to thank everyone for taking off time to attend.
Please, can they resend the form, please?
Okay. I just sent the link again in the chat section. Please just follow the link and fill in your information. Thank you.
Emanuela, you can go on. I'll come in later, please.
All right. As our host here said, it was really a privilege for me to be part of this, and then for me to also receive you all as guests for this event. It was quite an interesting one. I believe we all gathered knowledge. We all gathered one or two things we are going to share. We've empowered ourselves. It's not easy to have a cohort of youths talking about a particular subject. We raise important points. We raise very good points that I think we'll be able to share. The networking session also help us to know each other, and then we believe through this will continue. We'll continue the fight, because we have to go out there and make sure in one way or the other, we contribute to achieving universal health coverage in Africa. Thank God we are from many countries, and I believe let's not leave our seminar to just pass like that. Let's make it let it be an impact. Let's create an impact after this event. Let the event not just finish and everything we got ends, everything just stops because the webinar is over. Please, let's gather. I believe we have gotten something, and we'll go out there and make sure that we are a tool to universal health coverage in our community. So I want to thank you all for taking out time to participate to this event. I know it was quite a long one, but I can see close to about 30 to 40 participants could remain all through. That really shows the dedication and the passion we all had throughout the event. I really thank you all, and I believe we were able to make another event in a different area for us to continue to impact our community. I count on you all. I'm from IHO. You can follow us on our Facebook page, our Instagram page, and we have other events coming up. So you can join us. Let's continue to impact our community in several ways. So thank you very much. Don't forget to fill the attendance form and hope to see you next time. Thank you. Thank you all.
Okay, thank you very much. I must appreciate everyone who took off the time to attend this important webinar. I think we've done a marvelous job. Today was not only about talking. I believe the information and the knowledge that we gathered from here today is going to go a long way within the 10 years that we have to actually push us young Africans to see that we achieve universal health coverage. So this is like a challenge that we have before us. So we have 10 years to go. So what can you do as an individual? And if you're in a community, what can you do as a community to see that we actually move towards achieving universal health coverage? Let's go home. Let's not sleep. Let's try to put what we have been discussing into practice. And by 2030, I believe that we are going to be clapping for ourselves. Once again, thank you all for attending the webinar, and looking forward to meeting you all in other upcoming webinars. Thank you very much.
Thank you, everybody, and have a blessed Saturday and a blessed weekend. So bye to everybody. Thank you.
Thank you.
Thank you so
Bye.
much.
Bye. Thank you.
Thank you. Bye-bye.
Thank you all. Bye-bye.
Manu, please don't go off. Please don't go off.
Can you now stop?
Oh, I'm still recording.